I'm going to take it. Are you good?
Yeah, I'm good. I'm going.
All right. In 3, 2, 1. Bow, chicka, wow, wow. Yeah. Welcome. It's episode numero 7 on the Secret Handshake podcast. And my, oh my, we got white tea in the building. We got the old Dutch oven in the other side in another building.
Let's share with the people real quick though the government names. We got also known as Taylor Leach and Derek Holland.
Thank you for that. Way to interrupt me on that one. Such a great introduction.
Well, I thought you started it out a little odd.
The real government names.
I thought you started it out a little odd with the kind of theme music you kind of put out there at the beginning. It set an odd tone in my opinion.
Well, I just want to do something different because we always do like, hey, welcome to the podcast, and this is Derek. I want to do something different. We got to spice it up, put some music in it.
Yeah.
But bro, 7 episodes in.
It's true.
We're killing it right now. Having a lot of fun with this.
That is true.
On top of that, though, I mean, we definitely need to let them know how great the that would have been episode
5. Episode 5.
Yeah, 5.
Yeah. So we got to give credit where it's due. We had Rami on, Rami Rossis, jack of all trades, WWE fan extraordinaire. You guys nerded out pretty hard on that, which was fantastic. It's exactly what I wanted to have happen. Seeing you guys in your habitat was pretty cool.
Our natural habitat right there.
Exactly. No, but so, we've been having pretty good numbers so far on the show when it comes to just YouTube. We're on Spotify, iTunes, Apple Podcasts, Google Podcast. And the YouTube side, like I really like it just because the visual aspect, but the YouTube numbers on the Rami Rossis, and we've posted them up so people can see, but in the first 4 days, I checked this morning, we're at over 120,000 minutes listened just to that episode.
That's where you push that button so we can get the golf clap in the background.
The golf clap or those DJ horns that are like, no, I mean, but I woke up and I sent you the screenshot of the little stat card from YouTube, and I could not believe it just because, and I'm not saying that we shouldn't be getting numbers like that because we should, but at the same time, it's just like, wow, that was really cool to see. I mean, on the graph, it just looks like a hockey stick going up. So appreciate everybody that's tuned in. I think it's, that's minutes consumed. I think we've had over 1,300 or 1,400 people actually watch it, all the way through. And again, that's just on YouTube. So, really,
it's still pretty freaking awesome though. I mean, you got to give the love. The fans are checking it out. That's what we wanted, right from the get-go. We knew we had something special. Obviously we're not done. We've still got a lot of work. We've got another great guest today as well to continue that.
We do.
But it's been quite the ride. If you think about each person that we've had on here, and each show has gotten better and better each time. So, Doc, the pressure's on, just so you know.
Yeah.
We'll get you though in a second, though, but the pressure's on.
The bar has been set, so start tapping into all your friends. We got to get those numbers up. But yeah, so shout out to Rami. As Rami would say, he calls it the gift of Rami. That's kind of his coined phrase. So I think that's the gift that he gave us to the show, and we're definitely gonna have him back on because there was probably another 2 hours at least worth of content that we could have gotten out of him and stories.
Well,
so
it's the same thing. Not only him too, like every guest, we could have actually kept going. It's just,
that's
you
true.
gotta put a time limit at some point.
Yep.
I mean, obviously the show that hasn't even got to come out yet, it's about to with Demon.
Yep. Dale Torborg.
Yep. Yeah. I mean, that's another great show that we didn't even like, we had to stop. We had topics like that we like to have and everything with our notes, and it like literally we couldn't even get to any of them. 2 shows in a row.
Yeah, I know. I'm sitting there typing to you on the chat like, hey man, we got to wrap it up.
I mean, that's incredible. And I mean, something else that we want to add to this though is we want to start getting you, the fans, involved. We want to get your questions. We want to bring them into the show as well. And eventually, we're going to see some of the fans come on to the show too. I think that would be cool. Very cool. To interact with them and let them, kick it with us a little bit, have some fun that way too.
Yeah, I think that'd be great. Maybe bring them on with a special guest and so they would also be a special guest, but they kind of get that full experience of being in the same room with someone super cool and interesting that we're already bringing on the show and then contribute to it. But yeah, so
But with that though, I think it's something. Sorry,
I'll let you go.
Yeah, I know. I'm sorry. We have to do that though in the off season, just because I want to be able to be there with you. So that way we're both in the same place and we both get to interact with them.
You just want to get a picture with the cool person. I know.
Yeah, I want to be a part of it. I don't want it just to be you that gets to hang out with all the cool people.
No, that's for sure. But until then, what would be great, like you said, if you guys want to submit questions, however you want to submit them to us, you can hit us at the Secret Handshake Podcast at gmail.com. On the email, you can hit us on the Instagram DMs or comments. And we're going to start teasing out who the upcoming episode that we're recording with, the guest, so you guys can kind of frame your questions based around that. But we'll probably pick 1 or 2 per episode, and start incorporating those and kind of getting you guys involved in
just 1 or 2.
I mean, we barely have time for the rest of the show.
I just wanted to interrupt you when you were talking. That's all.
Thanks.
Sorry.
I appreciate it. But that is all in terms of the start of the show. Let's really get to why everyone is here today. We've got an awesome guest, completely different than any of the other guests we've had, which has been really the great part about it, is that the guests are so diverse. But we've got Dr. Douglas Wren on. Dr. Douglas Wren, thanks for being on the show today.
Well, thank you for having me. It's a great honor, especially the Lucky 7 episode.
Hey, that's true. Lucky number 7.
Hey, you going to the casino tonight?
I just may have to, right?
we're headed to WinStar right after this.
Yeah. I always say win with one.
Yeah, win with one.
That is a new phrase right there.
Win one for me. Yeah. No, that one didn't go over as well. All right. But anyways, so we got Dr. Douglas Wren on the show, but there's a million different types of doctors. Dr. Wren, how would you just kind of describe yourself? I mean, and we're going to get in, there's a lot of layers here to Dr. Wren. So just speaking from a medical standpoint and what you do with your practice, like what type of doctor are you? And what kind of practice do you run? And what's your day like as a doctor?
Sure. I'm an orthopedic spine surgeon, focusing really on minimally invasive spine surgery. You could kind of see me also as a holistic surgeon, because I'm not the typical modern, conventional spine surgeon. Especially, my mission and goal is to minimize the surgeries and then help patients prevent surgery. Also help patients prevent and reverse a lot of the chronic disease, which over 80% of the disease that we face every single day are completely preventable as well as reversible. So my primary practice is both not only spine surgery, but I focus on a stem cell therapy, which I've been doing for over past 12 years. And it's another way I can help patients, reverse their musculoskeletal problems and help them avoid a surgical process. And then also I spend a lot of time researching on nutrition and then providing free seminars in the community and empowering people with knowledge so that they can themselves prevent and reverse a majority of the chronic disease.
Okay. Wow. I mean,
I want to add something to that. So I played ball with a guy that played with me at the Texas Rangers. Matt Harrison was his name. And I know, you can't say certain things. I don't know if you operated on him or anything. He had back surgery as well. It was lower back. It got to the point to where he's not allowed to play anymore. I don't know any of the technical terms. Like, this is where you're probably going to help me more than anything. But I don't know exactly. I think they put them together, fused them together, was his back. He's no longer allowed to rotate it. It came to the point to where if he wanted to try to play baseball anymore, he wasn't gonna be able to hold his kids. Like, that's when he realized, like, this is serious, a serious injury. And it was very emotional to see, because that's like one of my brothers, and to know that he couldn't play because of the back surgery. Is that kind of like in that area? Do you get athletes like that coming in with those kind of injuries in the lower back to where you're having to fuse them together or whatnot? Yeah,
it really depends. Even their spine is pretty degenerated, and then you are even having to do a fusion. Depending on their condition, they may be able to go back and play, any type of professional sports. And so, just like even Tiger Woods, and for 10 years, everyone thought if you fuse your back, you couldn't really go back. And especially for a golfer, it increases produces a tremendous amount of a torsional stress when you're swinging the ball, right? But now he's playing better after having a fusion, better than 10 years ago. And, and the other surgeons kept on doing a lot of just, microdiscectomies, just, shaving off their disc rather than actually fixing the problem. And his spine was so degenerated, continued to have the pain. And so eventually he needed to have the fusion. And I think a lot of people are so afraid that they may lose motion if they have some form of a fusion, but it's also way it's done, way it's approached. And if you do it under minimally invasive approach, you minimize the trauma to your spine and then the soft tissues so that you can actually rehab and go back and play professional sports, even professional sport.
So being with that though, like I don't know if you can see my hands, like if these were his vertebrae and everything, does it have anything to do with his I guess you could say twerking with the pitching mechanics? Like, how you've seen baseball, correct?
Oh, absolutely.
Okay. So how like a pitcher, when they go for their, they push off and everything and the twist with the hips and everything, the back is twisting. Does any of that play into the factor of the back surgery though, in that aspect? Like if you're fusing it together, wouldn't that kind of mess things up a little bit?
At that level. But if he's at that level, even the spine itself is degenerated, you tend to lose a lot of motion. And so if it's a 1 or 2 levels, it only provides, so much motion. And by taking that away, the other disc can, take in place so that you can still maintain the motion. And majority of your motion actually in your torso comes from your hip joint, not necessarily in the lumbar spine. If it happens to be 1 level and you do the surgery, but again, everyone's different, depending on their conditions, right? And then how many levels it might be. But in most cases, if they're generally healthy, and then if they have a focus problem, 1 or 2 levels, I think they can have the surgery. And most of them, once they're healed, they may have to rehab for approximately about a year or so, but they should be able to go back and play.
Okay. So that's because I'm trying to, I don't know enough about it. I mean, he's told me a few things, when I was with him and stuff, but I just was curious as to where it was. I mean, I know it was lower back. It was literally, above his hips and like above his butt. So, it's like just that lower part. And he had like a little tiny incision, but I don't know, again, I think something was fused, but I don't know what correctly was going on in there to cause him to where he's not able to play. So it'd have to be probably something pretty extreme, right? Yeah.
So if it was a tiny little incision, most likely they just shaved out the disc, and then his disc may be degenerated. So not knowing exactly his condition, his surgeons may have said, well, if you really continue to play, you may need a fusion, and then if you have a fusion, your your career may be shortened. And so a lot of, just like Tiger Woods, for example, he kept on having small surgeries over and over and over again. I think he had it like 3 or 4 times, and it never worked because it didn't really fix the problem. And most people are so afraid of having a fusion, but it's the way it's done. And, and now the technology has evolved. So if you're doing it under with the minimally invasive technology, that you don't really violate the soft tissues, and you can rehab and you can go back. And that's what happened. And perhaps Tiger Woods would not have been able to have the fusion and go back maybe 10, 12 years ago. But with the current technology, if you have the surgery, it may take you about a full year to fully recover and the fusion to take in place. And then there's really no reason why they can't go back and play at that high level.
No, I understand. And I want to keep talking to you about it, but we definitely need to I want to get this going. We're going to come back to it. We got to know how you guys actually met. How do you guys know each other, you and Taylor?
Well, and that's kind of the thing too, is like usually the guests, so far all the guests we've had on, they're friends of ours. People that we know and interact with. We have like a whole list that we put together with, 70 names of people that we want to have on the show. And we're just kind of crossing them off one by one. But they're all people that, like we said, we're friends with. No, I think eventually once the show gets, every episode's doing 120,000 minutes, the first day, right? Then we'll have people kind of that we don't know asking to be on the show, which is, going to be an awesome thing when that starts to happen. But Dr. Wren and us, Dr. Wren and us, Dr. Wren and
I was there. Guys.
You were a part of it.
Dr. Wren, I don't know if you know this, but I was actually there.
Oh my God. Wow.
I was hiding.
We were Skyped. I had him Skyped in. It was just in my pocket. No, so Dr. Wren and I met. Actually, it was really through a mutual friend of Derek and I, Clint Stiff. So I know obviously you're friends with Clint. Yeah. I know Clint, from kind of the Dallas scene and just being, having several different mutual friends with him. He's a great guy. And then, I went out to eat one day with with Clint, and we were just catching up. We actually went to Moxie's out in Dallas, which big fan of that spot. Shout out to Moxie's. And anyways, he knew I was vegan. I recently had gone plant-based on my diet, and so he's like, man, you got to meet my doctor friend. He's got this Facebook group. And Clint, he's a really healthy, eater himself. He's not plant-based necessarily, but he is a pretty healthy eater. He really takes care of himself from a health standpoint. He sees, I think he takes a holistic approach to his medical care as well. But he was like, man, he's like, if you're vegan, you got to meet my buddy, Dr. Wren. He's got this Facebook group that's all for plant-based nutrition and, that kind of thing. And I was like, well, I would love to check it out. And, if Clint recommends you meet someone, then you typically want to go meet them, right? So Clint had sent me an invite to his Facebook group that day because it is an exclusive club to get into his Facebook group. You do have to get the invite, and you do have to. I haven't
got invited yet.
Well, yeah.
Well, you will be invited.
Doc, what the hell? Let's go.
And you got to get the approval. So there's a process to get in there. Okay, it's not just.
Wait, do I have to be vegan to join this?
No,
not at all.
Okay. I'm just making sure.
Yeah. So I went and I got he invited me to it. I got approved. I think it was the same day, and just started checking it out, and it became like a really awesome resource for me because I was pretty new into the plant-based nutrition game. And when you're kind of new into it and kind of figuring it out, all the resources and, insight that you can get helps, especially when it's coming from other people just like you, just all kind of trying to participate in the same thing. So instead of just going to some website and seeing what, someone wrote for a blog, you're kind of getting that more personal interaction within the Facebook group, which has been great. And then on the flip side of that, I didn't know this until after the fact, but you, I'm not sure, was it spine surgery or was it stem cell with Justin?
Oh, Justin, it was a stem cell.
Okay, yeah. So Justin Wren is a buddy of mine, which some people might recognize that name. Pretty well known in the UFC circuit, but he still fights occasionally. But Justin is, I've known him probably since I was 16, 17 years old, and he was the number one wrestler. I want to say Greco-Roman in the state, I believe. In his class, huge guy. I think he's 6'3", 6'4". And I think like when he peaked out weight wise, I want to say he was around 280. But he was on the Ultimate Fighter, progressed his fighting into mixed martial arts. He was on the Ultimate Fighter with Kimbo Slice, the same episode, which I think everybody knows who Kimbo Slice is. That guy's a monster. And he ended up having some success fighting within the UFC and a couple of the other mixed martial arts arenas. But one day I'm looking at Dr. Wren's Instagram and I see a picture with him and Justin. I'm like, man, this is like the smallest world ever. And Justin, he's on our list to get on the show. He's doing some incredible stuff right now with his Fight for the Forgotten.
Yeah, he's such
charity.
a great guy, great philanthropist.
Yeah, he's incredible. So the fighting is kind of taking a back seat, but he would be an incredible guy to get on the show. Joe Rogan is good friends with him and talks about him all the time on his podcast. So I mean, we're one step away, Joe, from being on your show. That would be the ultimate situation. We get Joe on ours, and then we go on Joe's. We just do a little trade out. Just a little trade out.
It'd literally be a dream come true for me. I mean, I always say it. I mean, this is probably our 5th time saying it out of 7 shows. He's the guy that inspired us to do this.
Definitely.
I mean, that's where it started. So, thank you, Joe.
Oh yeah.
Okay.
Yeah, I definitely enjoy his show.
Yeah, he does. Yeah. He does a phenomenal job. But so that's kind of the way that Dr. Wren and myself met, and he does a speaking engagements and he promotes through his Facebook group just to kind of educate people for free. And we'll talk more about that. But I started going to those, and then just said, hey, what's up? We're communicating through Facebook. It's just crazy what the internet can do, right? Because if the internet didn't exist, like you wouldn't be sitting here right now.
Yeah, exactly.
At the end of the day. So that's how it all went down. But I've got some questions when it comes to like the spine surgery, and you and I, we've had dinner and talked about, a little bit of this, and I've gotten a better understanding for what it is that you do. But I mean, you're not just any spine surgeon. You actually developed a pretty significant technique in terms of, how you operate on the spine, and not just you, but it's really become kind of like a standardized kind of procedure that not only happens in the spine, surgeries, but other surgeries, involving other parts of the body, right?
Yeah. The Derek wanted
Well, I was
to
gonna
say.
say, yeah. Sorry, I was trying to get you real quick before you.
Oh,
Because I
my
know this
bad.
is gonna be something. Well, you were rambling.
I was
so
on
I
a
had to let
roll,
you go.
man. I was on a
I know.
roll.
I didn't want to break it. But I was gonna ask, like, for Doc, like, when you're in front of all these people, do you ever get pretty nervous talking about these kind of things? I was told you're doing like big speeches, correct?
Yeah.
Like you're doing like a convention center thing or whatnot, like getting in front of people, talking on the internet as well. Does any of that kind of intimidate you, I should say?
Yeah, to be honest, one of the public speaking was not my forte. I really didn't enjoy it, and that's something that I really had no interest of doing. But especially when I came across plant-based nutrition, and I really did it to optimize my own health and prevent cancer because I get exposed to a lot of radiation. Once I found out the truth, and I couldn't help myself. I said it's my duty as a doctor and also a public servant that I really needed to deliver this message. So actually, initially, what I tried to do was get one of the other doctors that I know who's a plant-based, get him to do the other free seminars. I said, I'll set up all the infrastructures and then set up the seminars. I just need you to be the speaker, right? And then he did it once or twice, and he called me up and said, you know what, it's taking too much time, so I just can't do it. And I said, damn it, that means there's no one else.
Right,
So
yeah, by default.
Yeah, I really believe in this cause, so I guess I'm going to have to do it. And so I started doing it. And every month it got easier and easier. But when you have a passion for something, you just got to overcome the challenge. And I just started doing it. And it's been over 2 years since we've been doing the educating the community. And we have free seminars. And like I said before, my mission is to empower people so then they can do it on their own.
Right. And I mean, I like the angle Derek took here and just the public speaking aspect. I've done some public speaking in the sense of just speaking in, maybe not public speaking, but speaking in front of groups of people. Mm-hmm. And
it's not about you.
Yeah, I know. I'm trying to trying to deflect. No, but it's an interesting thing because, you've probably spoken in intimate settings where maybe you've got, 5, 10, 15, 20 people, but then there's also like the bigger settings and where you've got maybe 100 people or 2 or 3, 400 people, maybe even upwards. I think with the Earthling Ed, speech that you did, there's at least 500, 600.
That was about 600 people.
Yeah. And so what do you find easier, the smaller intimate groups or the bigger? Because I actually think it's a little easier to talk in front of more people than it is to talk in front of fewer people.
Yeah, it took me a little while to get used to speaking in a larger crowd. But, after a few times, it got easier and easier.
Yeah.
But, like when there's a large crowd, then you kind of forget. And I usually focus so much into the talk, and then I forget there's, 500-600 people there.
Right. Right. Because I think
it makes it easier when there's more people, because I feel like if there's less, you end up focusing on one person.
Yeah.
And it's kind of like you get stuck there. Whereas when you got a bunch of people, it's like, oh, well, crap, I can just look at everybody. You can move around a little bit more. Makes it a little bit easier. I mean, I don't speak in front of that many people. I do play in front of a lot of people, but I don't get to look at them and interact like you are. So it's cool to hear another person's perspective of when you're in the larger crowd. Like to me, if I was speaking, I can easily do it. I'd say, I could easily do it, period, because I love talking. But I mean, I feel like that's an easier edge is when you have more people, because it's easier to bounce around eye to eye, seeing everybody else's eye contact, see them locked into you, rather than just having one person, and you're in like a group of 5 and you're just stuck because they're just death staring you.
I agree. Do you, but like for in your perspective, Derek, when you're playing, you've obviously played in front of like a sold out stadium, but then I'm sure there's been like a day game in some, obscure baseball city where the team's really not doing too hot that you're visiting and you've got, barely anybody in the stands. Does that feel any different when you've got,
as a player, like, and a perfect example is when I was with the White Sox. I mean, we weren't doing very well, and the fans were great, but there's sometimes you're playing teams that also aren't doing very well, and not too many people want to come to those games because it's like
right.
You're not really into it. It's nothing towards any of those people, but it definitely, you don't have as much adrenaline flowing when there's more people and they're hyping you up. Whereas if there's nobody in the stands, it's kind of like, shit, I hope I get through this one. Let's freaking go. I got to motivate myself now. That's why I feel like when you're speaking in front of people, the more people it is, I feel like you get a little more passionate with it. Yeah. And like you're ready to take on the world.
Yeah, but what about the heckling aspect, Dr. Juan? That's one thing you don't have to deal with in your speaking is the heckler. Do you imagine that at like a plant-based nutrition? Which I guess that could happen. You could have like an anti-vegan activist that shows up trying to do a demonstration, which you've seen YouTube videos of that kind of thing. But
I have actually had a few people where the family members would bring their either siblings or their parents.
Okay.
And then they really haven't bought into the plant-based nutrition.
Gotcha.
And they try to counter. And so they would
while in front of everyone, like while you're doing your talk. Okay.
Yeah. And so, we do have few occasions like that. And I love that challenge.
Right.
Yeah.
Right. Well, I think it gives you, it helps validate the conversation even more when, because there's really one of two options. You can either come back with, information to help them understand in that moment, or you don't, and the conversation ends. And I think it gives you a little bit more of a chance to kind of really help them understand if they challenge it, because you're really just trying to break through, that wall that they have up, right then. Derek.
Well, I mean, I feel like too, like for me, you're going to stump me on so much stuff. Like I know he's vegan and I'll joke around with him. We give each other a hard time because I'll eat, the meat and all that stuff, like the regular chicken, all that good stuff.
He's one of those, Dr. Juan.
I don't bash. I don't bash him or anything like that. But it's like when you're learning something, it opens up more doors for you. Like my one buddy, Jason Cook, he's big time vegan.
Shout out.
He's been doing it for shout out Cookie. He's been vegan for I think a few years now, and I learned a lot from him. When I got hurt and had knee surgery, I told him, I was like, look, I'll go vegan for you for a month. The only thing that I had the problem with is I just felt like I was constantly hungry, which I know we're going to dive into it. I don't want to, I want to work our way to that. But I just noticed, like, hearing you say that, like, it made me think it's kind of like when a fan yells at me, like, throw strikes. I'm not out there throwing balls on purpose. And it's just like you saying, like, somebody would say something to you about, like, oh, vegan, that's a bunch of crap.
Right.
Then you give them the facts and they're like, oh, okay, I'll just go ahead and sit back down here. I mean,
right.
It's just like, I get it. I can understand definitely your heckling from the people that think that they know it all. Like, I mean, we're all guilty. Everybody does it. We all think we know it all. It's just the way we are as humans. But it's funny though, is hearing it from you, saying the hecklers.
I really wasn't expecting you to have that story, honestly, because I mean, I've been to his speaking engagements and I hadn't witnessed that personally, but I can totally see that happening. Derek, I'm just curious on the heckling topic. Have you had a moment where in a game at any level in your professional career where you actually had like a heckler kind of got under your skin while you were pitching? Like, have you ever actually truly had a moment of being bothered by one of those guys?
I mean, I was already out of a game, and as I was walking out, like somebody just kept jabbing at me, and then finally I was just like, all right. And I mean, I'm going to pop right here, but I was like, this fucking guy is driving me insane. Yeah. I mean, I'm not even playing anymore.
Right.
And it was just like letting me have it, constantly telling me how bad I sucked and I need to go back to the minor leagues and my career is over. Like just nonstop. I mean, just kept going. And then finally, like now I'm at the point though, you can say anything you want to me and I laugh about it because I mean, you're not going to get me. I'm in the big leagues and you're on the other side trying to tell me how bad I suck. Like, why aren't you here?
Right.
Those are the things like, it's the same thing for Doc. Like these guys are going to try to tell him how to do something. It's like, oh, so you went to med school. You did all this stuff. Like, get out of here with that. But yes, there's definitely people that can pop off and they try. I will say,
there's some good ones out there. There are some good ones.
That's what I was getting ready to say.
Standpoint. Yeah.
What I like to do though, like I have fun with it. Like I'll have fun with the fans. And if you give me a good one, I'm going to let you know like, hey, that was a good one. But if you give me something that's like terrible, then it's like, all right, dude, you got to try harder than that or something. Like I love being heckled because it's funny.
It's probably
most of the comments that,
what's that? Yeah, it's probably also a way for them to gain attention, right? And then
100%.
And so they want the attention for themselves.
Well, you actually, I mean, I've seen there's a documentary on hecklers and from a comedy standpoint, but then also they go into some sports and there are actually guys that, as weird as this sounds, kind of consider themselves professional hecklers that literally will go to games or events. That is their sole intent and purpose of being there. And it's kind of how they become, it's almost like a brand that they develop in a sense, like at these, sporting events and games.
Well, it's just like the Twitter trolls, all the social media trolls, all that stuff. They think that they get something out of it. That's the thing. And like, And it's entertaining, but at the end of the day, what sucks is like a guy in like a doc's profession, mine, like how we are, like we can't really respond back how we would really want to because we don't win. They will always win that battle. So I mean, it's true, but when you like hearing them and the comments that they say, like some of them just try. They try to see how far they can go because they know that they can get away with it because they're hidden behind a keyboard or they're hidden on the other side of the fence to where being an athlete, like we're like a caged animal. Like it's, we're like a zoo and these guys are coming in here and just yelling at us. Like that's kind of how it is. But at the same time, it's like if we pop off to them, well, there goes some money. We're getting fined for that. But yet they can sit there and tell us like, ridiculous stuff that we hear. Like I will say what I do think is funny about the hecklers. They really look up some information, man. They know your family. They know, they hit Google hard. Like there's no, like when I was engaged, when I was 25, people were making comments to me at Yankee Stadium during the ALCS when we were playing the Yankees. And it's like, you did your homework. Like I literally wanted to look up and be like, hey, that's good shit right there. You know what you're talking about. You Googled me.
Hit
you
that
checked
Wikipedia
it out.
page for sure.
Well, they need to get a life, right? I mean, so they have all the time in the world. So that's what they're doing. Rather than focusing on their own life, they're focusing on you, right?
They're worried about. They're more concerned in trying to bring you down than rather trying to make themselves better.
Yeah. What's funny
like worry about yourself. I mean, but it's true. Think about it. Yeah. Like you're coming to a baseball game and trying to ruin somebody's life, basically, it's behind or on the field or whatever, tell them how bad they suck, just make them miserable. But yet, have you done anything to benefit yourself and make yourself feel better? Like, how does that make you feel?
This, though, Derek, is that Dr. Juan, I think, is playing this card of like, I don't really support those kinds of people. But in all reality,
he's
he probably is a professional heckler. He's probably
I'll wear the mask.
Talked trash to you at a game before.
He's like, I'm going to see you when we get to San Francisco. I'm going to troll the hell out of you.
I think that would be great. He's throwing.
But it is true though. Like all these guys, like you said, you're not going to win. You let them have their fun, do whatever they want. It's their 3 seconds of fame that they get for trolling an athlete, a doctor, anybody, whatever it is. And my favorite though, I will say, is when they get on Instagram and it's like, they'll make a comment about me and then it's like tagging their buddy so you can see, look, I just did this. Look, I did this to Derek. Like, that's cool, great. Man. Yeah. You really got him on that one.
Like, it's almost like their buddies dared him to do it earlier and that's why he's tagging them. Like, I double dog dare you, man, to go leave that comment on his page. And then,
well, I mean, okay, here's a good one. Like, this happened just the other day and I still think it's hilarious. Like somebody tagged me on something and it was like Derek Holland's still playing or whatever. And this guy was like, Derek Holland's still playing baseball. And it's like, yep, 10 years in the show. Like, sorry about it. Like, you got to have fun with it though. Christmas. That's the main thing. Yeah. Hold this L, bro.
Yeah. Right. Hey, so Derek, don't interrupt me this time. But I
want
to get back to his minimally invasive spine surgery.
Yes. Okay? I'm sorry. Cool? I'm sorry. Yeah. But I just wanted to know, like, from Doc's point of view, you go out and you speak to these people. There's got to be somebody that's heckling you. I want to see, what your reaction is speaking in front of a lot of people as well.
Yeah, I mean, we went through that.
It's a different perspective.
We're good on the topic.
I know.
And look, here's the deal. Look, if you're going to keep calling him Doc for the rest of the show, you got to call me Marty McFly. Okay.
All right, I will. Okay. I got it for the rest of the show. You watch.
We're going back to the future. No, I'm just kidding.
1.31 gigawatts.
Yes. The flux capacitor is here. And Derek, I love you. I really appreciate you being my podcast host. I want everybody to know that so they don't think that our little back and forth banter. I don't want people to think I'm a bully.
I bet people think we actually don't speak outside of this show. Like, these guys really hate each other.
It's entertaining.
No, it's great. Anyway,
so go ahead, Marty. Go ahead.
All right. Thanks. What would that make you, Biff?
I don't know if I want to be Biff.
Who would you be in the movie then?
Dang,
because we got the two best characters. I feel like Doc and Marty.
Man, I don't know.
You got the hair of the Doc.
Technically, I do have the Doc hair. Just with
you got the glasses too.
Yeah, you're right. I don't know. Anyways, okay,
we'll figure it out. We'll come back to that.
By the end of the episode, we'll have it figured out.
Do it, McFly.
So, the technique that you developed. Let's hear about that. How does one develop a spine surgery technique?
Yeah. Well, this is something that I've been thinking about. The part of the reason why I went into spine, when I was soon after we immigrated to this country, when I was 13 years old, we immigrated when I was 11. And then when I was 13, my father had multiple back surgeries.
And where'd you immigrate from?
South Korea.
Okay.
So,
very cool.
People always ask, are you from North Korea? That is not typically possible.
Right. Yeah. Typically, you have to figure out a really sneaky way to get out of North Korea.
And so, but, when we came, we were pretty poor. My dad worked as a janitor. My mother worked in a flea market store. So he had his surgery at one of the public hospital in Tarrant County. I won't name it because that hospital was so bad.
Okay.
And he just had a really massive infection.
Okay.
And he had what it would have been, day surgery today. He was in the hospital for a week, but then that hospital stay was extended to 2 months because he got just a really massive infection because he was in open back surgery.
Oh, wow.
And then, he was pretty much, living with chronic pain for 20 years or so.
Wow.
And I knew that something had to change, and that inspired me to go into spine. And when I went into spine surgery, I did a training. I was very fortunate and lucky to train at Washington University, and got to see a lot of incredible spine surgery and then do the spine surgery. But there, they specialize in adult scoliosis as well as pediatric scoliosis. That's what you would consider maximally invasive surgery.
Okay.
And you flay somebody's back wide open and strip the muscle completely open in order to do the surgery. And I realized, okay.
So like how when you say wide open, like how much of their back from like the neck down? And yes, we do have Mila making her appearance right now.
Told you it was going to happen.
I'm sure she'll come through. But when you're saying you're opening someone up like that, like what does that look like physically?
Yeah. So basically from the base of the neck all the way down to the butt crack. And then we flay their spine completely open from the skin, from the fat, and then the muscle. We strip it off the bone. So like if you're eating a T-bone steak and then
that sounds
the meat
incredibly
off,
painful.
very painful, right? And so you're completely open, and that really increased the potential infection rate.
Yeah.
And so I was always thinking, okay, how do I do the same type of work without having to open their back? And that's where the minimally invasive surgery went in. And these are the type of surgery where you're correcting the curvature. So you would have to put screws and rods to correct their curve. And so I thought, okay, what if we used imaging guidance and then without having to open their back and do what we call percutaneous, make small incisions and then use the x-ray machine to help guide while looking at the screen and place a screw inside somebody's spine.
Wow. So like when you say imaging guidance, I know you said x-ray, but is it like basically a real-time x-ray where it's not having to be developed, but you are seeing what's happening in real time?
Yeah, exactly. The imaging guidance is, what we call floor scan. So it doesn't emit as much radiation as a regular x-rays, but we use it in the operating room. And rather than actually printing the film, we can actually see it on the screen, computer screen. So it's a live x-ray.
Wow.
And that's part of the
Wait. So hold on. I want to make sure I got. So was this? Did you say something was going in?
Yeah, going.
Because I kind of got. I got a little bit, but my Skype kind of chopped a little bit, so I missed a little bit of what was said.
Yeah. So we in open spine surgery, we flay their back open. So we actually look at the spine and place a screw into the spine. But minimally invasive surgery, what I wanted to be able to do is, without flaying somebody open, just make a small incision within the skin, and then what we call percutaneously. So without opening their back completely, place a screw through the skin, through the muscle, into the spine, so we don't have to strip their muscle off. And so that's the type of technique that I help develop.
So like roughly, is the incision like the size of like a dime or a quarter, or like what would be a good representation?
Yeah.
Of that?
So if I'm doing just a pure discectomy, it would be like a size of a dime, and if I'm placing the screws, it would be a size of a quarter.
Wow.
Yeah. And through that small incision, I'm able to place the screws and then also something called a cage.
Here, I'm gonna let you guys keep talking. I'm gonna go handle Mila real quick in the most friendly animal friendly way possible. So
we know you're vegan. We got it.
Yeah. Yeah. Please don't beat him. But so and then using rather than opening the back and then actually looking at the spine, I'm looking at the X-ray machine that's live in order to actually accurately place a screw through the skin, through the muscle, into the spine. And then that's how we're doing the fusion. That's why with the minimally invasive fusion that the patients are able to recover much faster. There's virtually minimal bleeding, and the risk of infection declines significantly. And experiencing and watching what my father had to go through, and with that massive infection, that gave me a lot of motivation to do things differently. And I always, I have a little bit of an engineering background, always thinking every time I'm in the operating room, thinking, how do we make this better? How do we make this easier? How to make it simpler procedure for other spine surgeons to perform? And then how do we get our patients who used to stay in a hospital a week and then make that into a day procedure or stay in a hospital 1 or 2 nights?
So with that, I mean, this is going to be a little bit off, but so I had knee surgery, I had a microfracture, and they took they took a camera, went into my knee and stuff. Mm-hmm. Do you do anything similar to that as well when you're going through the back?
Yeah, so
to give yourself a little more to see and everything as well.
Oh yeah, absolutely. So there's so many different kinds of spine surgery, and when we're actually doing a discectomy, there's a type of procedure where it looks just like the knee scope, just like what they did in order to do the microfracture for your knee. We actually have a very similar type of camera that goes into the spine, or we may use a microscope. So depending on where the disc herniation is and how big it is and the different approach we take, we may utilize we call it endoscope, and in order to do the discectomy, and so that we can actually see it right into inside the spine.
Oh, okay. No, that's why I was curious is when you do stuff like that. Now, does that interfere with the screws as well when they're in there?
No, not really. And when we're placing the screws, by that point, all those the cameras are out, and then now we're using the live X-ray machine in order to place the screws.
Now, is this okay? So once you put the screws in, the person, they're still out, correct?
Yeah. During the surgery, patients are completely asleep.
What's the recovery
So how are you?
time,
but
though?
I mean,
sorry, I'm interrupting. I interrupted. It happened.
No, you're fine. You're fine. It goes with it. They go together. That's what
right.
My thing with it is. You're talking about the X-rays. Well, how are you getting these X-rays with the screws in? If maybe I'm missing something.
No, so there's the incision.
Correct.
What's the word? It starts with a P.
A percutaneous approach.
Okay, so there's the incision, and then through the incision, that's when he's able to send in the camera. He's got the live image guidance going on with like the live X-ray. But once the screw's going in, the camera's already out at that point.
Yeah, camera's already out.
Yeah, so there's no interference.
So I'm thinking of so the X-ray is up above. Then it's already there. Mm-hmm. It's just like okay. I got you now. So you're basically the X-ray machine. They're on top of the table or whatever for the X-ray. They're already set. So the X-ray is there too.
Yeah, so X-ray also rotates, so it gives you the like front of view and also give you the side view as well. And so that you have to imagine 3-dimensional view in your brain by looking at the 2D pictures. And so,
wow.
And then, if luckily the muscles are striated, so we can split the muscle open. And then once they're open, then we're able to actually place the screws through the muscle without damaging the muscle and then into the bone. And while we're doing that, we're visualizing on the floor scan, which is the intraoperative X-ray machine, so that we're not placing the screw right into the spinal cord or into the nerve, right? That would be really bad. That would be paralyzed, right? That's the purpose of the surgery.
Yeah.
And so we want to make sure that screws are actually inside the bone rather than outside the bone and potentially hitting the nerve.
So how long does something like that take for rehab?
So it depends how many levels, right? So typically first 6 weeks, we tell them don't bend, don't twist, don't lift anything heavier than 10 pounds. And after 6 weeks, they go under physical therapy for about 6 weeks. And so after about 3 months or so, they can get back into their typical routine activities. If you're playing sports, we tell them wait for about 6 months to start getting back into the sports activities. Typically by about a year or so, the fusion, if we do a fusion, it should be in place. And so then it's pretty solid, right? And so they can go back and do whatever they want to do.
Wow.
Now, with that though, how similar, and when I say similar, I'm meaning more of like the rehab, because I just heard you mention you can't lift anything heavier than 10 pounds or whatnot. I had a hernia. Mm-hmm. It was an umbilical hernia. Mm-hmm. I got that repaired. It was small, nothing major. But I was told also, I'm not allowed to lift any weights. Is that kind of similar in that aspect of because of the lifting, as simple as something like lifting a gallon of milk. I couldn't do anything like that. Is that kind of like that same boat, but it's a longer period of time?
Yeah, exactly. Because it increases the pressure. So if it's, let's say, for example, if it's a discectomy surgery, and disc, you can imagine like a jelly donut. And what disc herniation is, you take a bite out of the jelly donut and you squeeze it. Then what happens? Jelly pours out, right? And then the surgery is to go inside and clean out the jelly that's been poured out. However, there's really no technology to create the seal
close it back up.
So it takes about full 6 weeks for that to close naturally. So if you're lifting something, you increase the intradiscal pressure. So it's like squeezing it again. And then the jelly can potentially come back out.
Because it might not have sealed up properly.
Yeah, exactly. That's why
I've got... no, you're good. Go ahead.
Yeah, so that's why we want to wait for about 6 weeks or so that the defect would naturally heal over. So then after that, then you increase the activities, do the physical therapy, and even with the increase in intradiscal pressure, that chances of the jelly coming back out is minimal.
Okay, and with that, now I'm going to ask the question because I'm sure somebody is curious. We never have to know any of this stuff. We don't get to experience it, and it's going to be kind of funny. But what's your long waiting period if you wanted to go out and have sexual activities?
Well, actually, that's a really good question. And we actually
I would imagine that's a pretty common question.
Yeah, but it is a good question. And we actually do have a brochure on how to have intimacy when you have back pain. And also it includes the topics of after surgery also. And we tell them typically try to wait at least 4 weeks or so.
See, Derek had great foresight with the theme music he started making at the beginning of the episode. I didn't realize that you were going
porno music.
I didn't realize you were taking it here, man. So I fully get it now. It makes a lot of sense.
But on top of that too, though, okay, so obviously you got the sex part out of it. What about when it comes to taking a shower? A simple thing is, if I'm washing my legs, I got to bend over. Or I got to pick them up. So that's requiring me to move. What are you going to do on that procedure too? Like, how do you go about that?
Well, if you don't have a significant other to support you, even
first date.
Yeah, first date. When we say don't bend, it's just like you can't live a life without bending, right? And so we're just telling people to just be cautious when they're bending and try not to bend, extreme amount. Try not to twist extreme amount, but you can't really live without really truly bending or twisting.
Well, as me, like I'm a person that'll think of, if you told me, like for instance, when I had knee surgery, I had to keep everything off of it. That was something that they told me is no pressure on the knee. You had stem cell and PRP in there, and you don't want, that stuff going out like you were talking about with the jelly going everywhere. Same thing in that. Like I took it so serious that I made sure I didn't. Like I overthink those things. If you get people that are doing that same thing, like you could drop your keys just going to the car. Like you can't go down and get them because you think about that. That's why I'm referring to it as the same thing. If I go take a shower, a bath, whatever it is, I'm going to be afraid to wash my legs, like to bend down and get them because I don't want to overbend. It's funny, but it's true. Like I guarantee there's people out there that they're paranoid as hell. Like I'm not bending over. I don't want to have to go through this again, or I don't want to slow down my rehab process.
Yeah, absolutely. And most people, do follow the instruction pretty well. And there are certain tools that you can get. And also therapists teach them how to bend without really bending too much. And then also using your legs rather than bending your back. Then you would actually use your legs to get down.
Or like a squat.
Yeah, to squat, to pick up the objects if you happen to drop it or need to pick them up. And that's how most people should actually lift, right? Even if you just bend over and pick up a piece of paper improperly, that's adding about 7 times your body weight to your disc. So, so that's why proper lifting technique is so important.
Can you share them?
Sorry, I got yelled at. I'm not allowed to ask any more questions at this moment.
No, I just want to know if you could share the guest a little bit. It'd be nice. It'd be nice to ask a couple questions.
I'm actually intrigued by a lot of this stuff. This is pretty cool. So I'm sorry that I'm asking the questions.
I'm glad that
wait your turn.
I'm glad people
raise your hand if you want to speak.
I'm glad our viewers know how to bend the proper way after a spine
and to have sex.
Right. Exactly. You're right.
Nobody was going to ask that question.
You're right. I wasn't.
But and like when you bring it up though, saying like using our legs, I feel like even, with sports aspect of it is when we use our legs at some point, we're still using the back. Like I don't think people realize how much the muscles are connected to the back when we do simple things of just squatting or whatnot. Like I love to squat. That's one of my favorite things to do. When I'm working out and stuff.
People probably realize from a pitcher's perspective how much of it is your legs, how much of the velocity.
A lot of people don't
comes from your legs.
A lot of people do not. A lot of coaches that I've dealt with kids when I do camps and stuff, a lot of people think that pitching is just your arms. They think that's all it really is the arm is just a whip. The legs generate, and so does the core. It comes basically from your core to your legs down, generates velocity and all that. That's where they say gosh dang it, the G-force rises. It comes through your legs. Like I'm not really explaining it very well, but all the power comes from the legs.
I played with a kid in high school. He was a grade or two younger than me. His name was Shane LaRonde, and he was a pitcher. I was a catcher, and I really saw that firsthand for the first time when I was always under the assumption, even as a catcher my entire life, that like, okay, these guys just have magical arms that are throwing this heat. Well, like I said, he was a year or two younger, and he was playing up, and he was hitting like his sophomore year. I want to say it was his freshman or sophomore year. He was hitting, like in the high 80s, like, or sorry, in the low 80s. I think he was hitting around like, 79, 80, 81. Well, then the entire off season leading up to our next high school season, him and his dad religiously worked out in the gym, and all they worked out for the most part was his legs. Like every day, working and strengthening his legs, doing a little shoulder rotator cuff work as well, but didn't throw a baseball, didn't do anything like that. And then obviously conditioning, but it was apparent that the focus was 110% on the legs. I'd never even heard that before. He comes back the next season from throwing, 80, 81 the season before, and he's added 5-6 miles an hour to his fastball, literally just off of that leg strength. I'm sure you've probably experienced similar
situations. That was the same thing for me.
Yeah.
It was the same thing for me. When I got to the Texas Rangers, I was throwing 90, 91 at the tops. And, you get into an actual weight program, nothing. My college did a great job. They got my velocity to pick up too. But as you continue to go and your body's maturing, you're doing these leg workouts. And I noticed that my velocity picked up because I was actually getting a lot more strength, a lot more flexibility. And, it kind of just took off from there. But I'm not saying that's your true reason. Like, don't go out there and just squat and think that you're going to start throwing 98, because it's not. I mean, there's still more to it. You got to have the flexibility and all that. But a lot of the velocity and the power comes from the legs.
Right. No, totally. And so, I mean, sorry for the little side, offshoot there, but
that's pretty cool.
I've got a question. So I'm more of like a documentary kind of guy. Like when it comes to like movie, I love learning about things, but kind of back to my original question, like how do you actually develop a technique like that? Because I mean, to develop a technique, and when I say that, just so people understand what that means, that's something that you actually have to get approved, right? It's not like you just came up with this technique and then you just get to, go start doing it in practice. There's a whole process that happens here. What's that process like?
Yeah, so you actually have to have the right tool. That would be the first step. And then typically you have to get it FDA approved. So what I've done was...
so is it the tool or the technique that's getting approved by the FDA, or a combination of both?
Usually it's the tools.
Okay.
Right?
Okay.
And if as long as the technique itself is not too different from what you're doing. And so we were doing actually exactly the same surgery without opening somebody's back.
Okay.
Right? And so one day, I was in the operating room and I asked one of the engineers to come visit. And said, here's my goal, and this is what I want to achieve, and I need you to make me this type of tool. And then when he did, then we went to the cadaver lab, and then
and for what's a cadaver for the people that don't know?
For unfortunate souls that has passed away, and then but generously donated their body.
And not to get off the topic, but is that? I mean, I know it's probably something that after you've seen deceased body after so many times, you probably are a little more numb to it, but it's got to be kind of, I mean, most people don't have that experience in their lifetime. You know what I mean? In terms of, when that first time, I'm sure that probably happened in medical school for you.
Yeah.
Is that kind of a shocker? Like it's about as real as it gets,
It is. And you have to respect the individual who donated their body.
Right.
And initially, it's quite an experience, right? and you know that individual used to be a person.
Well, it's probably a little humbling in a sense too, just because that used to be a person just like you, breathing and seeing and smelling and all that good stuff. So
because I mean, there's so much sensory going on. And number one, in the anatomy room, it really smells because of the formaldehyde.
Oh wow!
Right?
Okay.
And sometimes when you get near it, your eye starts burning. And then one of the things that my medical school did was dissecting the head and face was the last thing.
Oh, wow.
So they had it completely wrapped up.
Man.
And so then they didn't, once you open the face, then you make a personal connection.
Oh, right. Because that's the identity at that point, right?
Yeah, exactly. Yeah. And so that was the last thing. And I still remember the day that we start dissecting somebody's face and then open the face, and that just, everyone paused for a while. Right? Everyone in my table paused for a while because it became so much more real. The rest of it was, just body parts.
Right.
But then once you see somebody's face, then you make even they're dead,
There's
you
definitely
make that
a connection
that you make. And so, some people, when they, go to a funeral, if an open cast and you see that individual,
similar kind of
it's weird, right?
Yeah.
But then now you have this individual that's completely naked, and then their body essentially torn apart because we've been dissecting to learn the human anatomy for months at a time, and then last thing in their body that's left is their head.
Yeah. Wow. Right. So that is back to the process. Yeah. You are actually then that tool that's developed to do the technique that you're working on. Mm-hmm. You go into the cadaver lab and you actually practice the technique with that tool on cadavers to prove that this is possible.
It's possible, and then the tool that we made is actually workable. So then the engineers get to the work, and they produce the prototype, and then they have to do a series of tests, and it may take anywhere from 3 months to a year. And after that, then they submit the tools and instruments and the products to the FDA. And once the FDA goes through their process, it may take anywhere from 6 months to a year. Then they approve the actual product.
So total process from start to finish, kind of, I guess once you got like a viable, idea that you think has some legs, like
it could take anywhere from 2 to 6 years.
Oh, wow.
Yeah.
Okay. And for in your case, how long did it take?
In our case, we got the product live in about 2.5 years.
Okay. Wow.
Yeah.
Okay. Awesome. So then
wow.
When the product goes live at that point, do you team up with a pharmaceutical company or some other company that ends up kind of becoming like the mass distributor of the tool and all that? Is that kind of how that works?
Yeah. So I work with the medical device company.
Okay.
And they also then help because it's extremely expensive to go through the whole FDA process, and you have to hire a lot of engineers. You have to do third-party testing. It could cost millions. And so rather than, especially when I first started developing the products, it was just right out of a fellowship. So just new to the practice, and I didn't have the funding. So then I would let them develop it, and I would get the royalties from the product itself.
Gotcha. So like at this point, how long has the technique been out in terms of being able to be used in practice?
For about 15 years or
15 years. And in that 15 years, do you have any idea how many doctors, if you had to kind of ballpark quantify it, have used your technique and
yeah, thousands.
Wow.
Right? And so now the product's been out for a long time, so that's
incredible. That's a major impact that you've made in the medical field when it comes to doing surgery like that. It's got to give you a sense of like definitely accomplishment, but essentially your technique is helping, I'm sure, change lives for a lot of people in different types of ways. Because like we had mentioned earlier, it's not just being used in spine surgeries now. Like what would be another example of a surgery that could use your technique that's not spine related?
Well, that type of, those type of idea gets inspired. And so then, it may be used in other orthopedics areas, right? The whole idea, their tools and equipment may be different.
Right. They might have to alter it slightly for a particular procedure, but it's the same basic concept that you develop. And
what happens is that the patent period is over. So then the other company can develop something similar. Back 15 years ago, there were only a handful of people who would perform this type of surgery. And when I first started, everyone in the community said you cannot do minimally invasive surgery in spine because there's spinal cord, there's nerves, and that it's too dangerous.
Is the danger that they were assuming based on the lack of visual in terms of being able to see with the naked eye exactly what's happening?
Exactly.
Okay.
They wanted to be able to see everything. Right?
Gotcha.
So I said, thank you, Mom, for letting me play video games, right? When I was growing up, because now I can watch a screen and then be able to picture a 3D image in my head.
And do you actually have somewhat of a controller like in your hand that you're using? I mean, that's not like an Xbox controller, but it's
not in the spine. And now the whole surgical field has advanced. So they do have robotic surgery where they do actually have, for example, in general surgery. And Derek mentioned, a hernia. Now they can do hernia surgery with the robotic. So it's not a robot performing it, but they actually have a tool. And then doctor goes in and then have this kind of like the virtual reality.
Right.
And then they have a separate controlling system. So they're not right by the human, the now, actual patient.
I do think though on the robotic surgery thing, and I could be wrong, but I can't remember what the procedure was. I want to say it was something related to the heart, but I think China just had like one of their first like robotic artificially intelligent. I mean, obviously doctor there standing by, but the whole procedure was actually done robotically without the doctor intervening in the actual operation. It might not have been heart, but it was in China. I'll have to look it up. But I didn't know if maybe you had heard anything about that. Where you kind of bring the facts to the conversation.
Yeah. But so far, most of the robotic surgeries are like, there's a station and it's almost like a virtual reality station where doctor go in and then they actually have the controller. So it really is like playing video games.
And do you actually, or have you in the past been a part of teaching? Because I'm sure there's a learning curve here. Like you come out with this new technique, doctors want to use it, but like how quickly can a doctor learn your technique? Like how much training does it take for them to start doing your technique? Let's just use the spine as the example, and then do you actually go out, or have you gone out in the past, maybe when it first launched, to help educate and teach how to do that?
Absolutely. So when it's first out, that you have to actually train a lot of the surgeons, and they can't practice on actual patient, right? So we would host the cadaver labs, and the medical device company would host a cadaver lab, and then invite the surgeons to come into the lab, and then with the actual floor scan, actual tools and equipments and products, and they would practice placing the screws and performing the surgery on the cadaver.
Wow.
Yeah. Wow. And we had to do that for many doctors. And now most people have adapted, or because of the consumers have been demanding minimally invasive surgery, the surgeons who refuse to learn, because although it's the same surgery, the approach is so different, and some of them have really resisted to undergoing minimally invasive training in minimally invasive surgery, but then now they're forced to.
And is it cheaper for the patient to do the minimally invasive? Is there a cost benefit for the patient?
The overall cost would be less because you're not in the hospital more than 7 days. You're either day surgery or you're going back home the next day. You get to go back to work much sooner. So if you look at the overall economics, it's significantly less. Infection rate is significantly less than 1% for minimally invasive surgery versus over 7% for open back surgeries.
Right. And the higher that rate, you might end up back in the hospital spending more money just to deal with the infection that comes from.
So each time somebody has a spine infection after spine surgery, that's an additional $150,000 to $200,000 in cost.
Wow.
Good Lord, that's
some
a
serious
lot.
money right there. Okay. I mean, Derek, just curious, have you developed any pitching techniques? Have you contributed anything to the world as significant as this guy right here?
No, I can't say I have. You guys got me on that one. I mean,
isn't that crazy though? I mean, it's
just to be able to say you could do something like that that's got to be a cool feeling to you.
Yeah, I mean, it has. It's been quite a journey, and really enjoyed the process. And it's just, I love asking why and how it works. And I live by the KISS rule: keep it simple and stupid, right? And
they do the same thing with pitching. Yeah. It's always said when you go out there and pitch, just keep it simple, stupid. That's what you always got to tell yourself.
Yeah.
And I mean, the thing too is like, you're not done. You feel like there's more that you can keep doing, right?
Yep. And then also when you're designing a product, you can't, design a product for the best surgeon, because there's a wide range, right? And there's some great surgeons who's got great skills and great hands. And then there's some surgeons who are naturally mediocre, right?
Sure.
And then when you design a product, it has to be simple enough And you don't want to make it too complicated because operating room, the surgeons are control freaks because there's so many different things that can happen while doing in surgery, right? Because everyone is made differently. And so that we try to control the scene as much as possible, right? Control the staff, control the bleeding, control the imaging staff. And then all the tools you have, you want it same way every single time because surgery is never the same every single time.
Right.
And so you want to design a product that is very, very simple,
right?
So that just about anyone can utilize it.
Gotcha. That makes sense.
Do you ever get nervous going into a surgery like that? It's something I would say like more, it's probably not you now, you're so used to it, but like coming through like as a rookie, when I got up to the big leagues, you got the butterflies, you're nervous, you're sweating and,
I mean, cause it's like kind of a big deal. I mean, you're literally
you're
doing something to someone's body and their livelihood.
I mean,
and you could mess up and it could become something very severe.
Yeah.
So I'm just like curious if you ever think about, nervousness or anything like that going into it.
I mean, I see it as a privilege. I still remember, when you're in training, when I was a resident and then when I was a fellow, even though my attendings allowed me to do a lot of surgeries on my own, you always knew that they were, behind you, right? Or you could easily call them to come back down to the operating room and help you and get you out of trouble. But I still remember the first year, the first patient that I operated on my own, me as an attending faculty. So then buck stops with me, right? And so, I don't think I slept very much the night before. I was going over the imaging, the surgery, visualizing it multiple times because I wanted to make sure my shoulders were pretty heavy. But then, after a while, you get used to it. But even then, when I evaluate the patient, and just like not everyone's made the same, even though the surgeries that I do are very similar, everyone's different. Some patients are skinny, some patients are fat, some patients have vessels where it really shouldn't be there.
Sure.
And so in order to get to it, I have to move the, the vena cava or the aorta around. And so that if I'm not careful, I could easily nick it and then patient could potentially die.
Well, it's essentially you probably have the same kind of blueprint and game plan going into it, but because everyone's so different, it's really, you have to be prepared to really, flex and adapt to that. You could probably be as prepared as you want to be, but then as soon as you get in there, you might realize that, okay, I didn't see this, and then you kind of alter your game plan a little bit.
Yeah. Yesterday was a perfect example. I was fusing somebody with a severe spinal cord compression. It was at 3 levels, right? From C4, 5, C5, 6, and C6, 7. So you have 7 bones in the cervical spine, and I was fusing basically 4 of them together.
So they had a pretty bad back.
It was pretty bad. He had significant weakness and also pretty significant atrophy of his arm.
So what does that mean for him though, in terms of before he comes to you? What's his day like? Is he just in extreme pain all day long?
Yeah, pretty much all day long. And then also pain he thought he could deal with, taking pain medication he got from the primary care doctor. When he couldn't pick up a cup of water, he realized something was wrong.
Yeah, that's a problem.
Yeah, and significant weakness. And when we got the imaging, his spinal cord was severely compressed. And if he happens to fall, hit his face, if he gets rear-ended, he could potentially get paralyzed. And so we decided to go into surgery, and he was a pretty heavy-set guy. And typically you can see all the different anatomies, such as a sternocleidomastoid, and then you could see the carotid artery sheath. But because his body was so inflamed, that everything was scarred. And so it was just big one mush. So then you have to carefully tease it away. So sometimes it's easy. You make a skin incision, you see all the anatomical structures. You kind of push them with your fingers and open up, and then you see the cervical spine right away. You the case yesterday, you couldn't visualize anything. So then if you didn't know whether it was something was a nerve, whether something was a vein, something was a artery. And if you happen to hit the artery and then all of a sudden there would be a significant amount of blood loss. So you have to just, tease layer by layer. So which would take a significant amount of time to do so. So not everyone's exactly the same. We're generally made the same, but once we go inside the body, everyone's different.
Right. And how long did that procedure take yesterday? Did it go, what you ran into, did you end up did it end up prolonging the surgery, or was it about this?
So that surgery probably would have taken me about 2.5 hours typically.
Okay.
Yesterday it took me about 4 hours.
Okay.
Yeah.
Okay.
Because
Wow.
Another 30 minutes. Which I mean, not to belittle that, but it's. I'm sure there's other scenarios you could run into that would extend it well beyond a 30-minute.
Absolutely. I mean, sometimes you get into a situation where if somebody's anatomy is so distorted, and then let's say their vein is completely stuck to the spine. So you actually have to carefully tease. I mean, the vein is sometimes it's like a rice paper. If you just look at it funny, it starts to tear and it starts to bleed. So you have to carefully tease it away. If not, all of a sudden there's just massive amount of it's like flooding of blood that will be coming down. So you have to carefully tease it away, because if you don't act real quickly, in those type of cases, we also have vascular surgeons who's working with us to make sure that doesn't happen. But that patient could potentially die. And luckily, I've never lost a patient.
That's awesome.
But some surgeons, because they do get into this difficult situation, the patients do end up dying.
Man, that's tough.
See, that seems nerve-wracking with all of that. I mean, once the blood starts to come out like that, I mean, as a person like probably me and T, it's full-on panic. Like, what the hell do we do? With you, it's, nice, calm, easy. Continue your thing. Like, we got this under control.
Very
Don't worry
poetic.
about that. Boom. Yeah, it's just, you get to take it so easy. But as somebody that, doesn't know, for instance, me and T, what is like probably the most common back problem that you get that comes into your office?
Yeah, I would say there's two different groups. One is younger group, and then there's the older group. The younger group tends to have more of a herniated disc that's extruded out into the spinal canal, and that's compressing against the nerve.
And when you say herniated disc, like I have no idea really what that means. At the end of the day. I mean, I've heard it. I've heard it my whole life, but what's actually happening physically in my body?
Yeah, so the disc is like a cushion between two bones in your spine.
Okay.
Right? And then, as I mentioned before, disc itself looks like a jelly donut.
Right.
There's an inner layer, and then there's a thicker outer layer. And so, depending on your genetics or depending on your activities level, sometimes you can actually tear the outer layer. And then because there's a pressure, that jelly will pour out. And if it pours out into the spinal canal is encased by the bone, right? And that's where all your nerves are sitting. And then if it comes out and then presses against a nerve, it's like having a big rock inside your shoes.
Oh,
right?
Yeah, definitely don't like that.
Don't like that, right? And so only way you're going to be able to get rid of it is I tell patients, take off your shoes and take out the rock.
Right.
And so in spine, since you can't take off the shoes, you have to go in and you have to unroof the top of the spine and then go in, move the nerve aside, and then take out the herniated disc.
Okay, and then you say that's more common in the younger patients that you see.
The younger patient.
And then what about on the older patient?
And then the older patient, because of the arthritis, they develop a lot of bone spurs that grows. And then that it starts to dig into the spinal canal, and then the pressing against either spinal cord or the nerve that comes out the spinal cord.
What about something like scoliosis?
Yeah, scoliosis is something that I used to do quite a bit when I first started to practice. And then there's two sets of scoliosis. One, the adolescent idiopathic scoliosis. That means when they say idiopathic, we don't know why it happens. So it tends to be teenage kids, and they develop a curvature, and the curvature is actually the twisting of their spine. And so then we would have to, if they don't correct itself or stop, then we would have to put screws and rods through their back, anywhere from T4 upper back all the way down to their potentially pelvis to straighten out their back. And for adults, because of the arthritis and degeneration, that they lose the disc height, that gelatin material, that cushioning device is degenerated, and then their spine starts to twist, and then they develop the curvature. So there's the adult scoliosis. And those tends to be a lot more challenging because they also have significant amount of pain because their nerve is compressed. So we have to unroof the nerve, make sure they're decompressed. And then after that, then we put the screws and rods to hold it together.
Got it. Okay.
Oof.
So, I mean, that's really interesting, and I want to. We're probably going to come back and forth to some of these topics here, but the next thing I want to bring up, and this relates to Derek. Derek, you mentioned it earlier. You have experience with this, and I'm kind of curious if this actually also, part of what you do plays into the spine surgery part of what you do if they ever go hand in hand. But you are, and correct me if I'm wrong, like you do stem cell therapy on patients. So not only have you done like, all the research that goes into it and been a part of the research, but you're actually practicing, with stem cell therapy. And I know, Derek, you had that. What was it? Your knee that you said?
I had it in my knee, and then I also did it once in my shoulder as well. Yeah. Just because I was dealing with the injuries constantly in my shoulder, and I felt like it was something that I'm going to try it. I want to see if it can benefit me, if it can help me. How's it going to take care of the issues? And it's been actually probably one of the best things that's helped me out with my career was doing that. But it's the knee was PRP, which I don't even know what does PRP exactly stand for? I know it's blood, you spin it, and then it goes back in. It comes out from your hip, right? Or your bone marrow.
Yeah, well, there's a different kind. So what kind of stem cell injection did you receive in your shoulder?
Well, I had umbilical for both. As far as I know, it was for my knee was also umbilical as well. And then obviously my shoulder was umbilical as well.
Yeah. So when you talk about there's stem cells and then there's a PRP, platelet-rich plasma, they all fall under the regenerative medicine category. So first, the PRP, platelet-rich plasma, is you actually draw it from the blood, right? And so like if you're getting your blood drawn, that's pretty much the same approach. And so let's say you draw about the 60 cc's and then you filter it. And then you isolate the growth factors, and then you put it in the centrifuge, and to collect the portion of the plasma or the blood that has high concentration of the platelet, which has a lot of growth factors in it. And then after that, then you inject it either into the joint or into the soft tissues or tendons or ligaments. The platelet-rich plasma tend to work better with the soft tissues. Let's say somebody with the biceps tendonitis or, rotator cuff tendonitis, and it's not a full thickness tear of the rotator cuff. And it's also good for anti-inflammatory effect. And rather than using steroid, a lot of athletes, especially football players in the old days, they would put the lidocaine or Marcaine and then steroid so that they could, reduce the pain and go out and play again. What they found was that it's, even steroid along with the numbing medicine, they're actually cytotoxic to cartilage. So you really shouldn't have your joint injected with the steroid or Marcaine or lidocaine.
Is cortisone part of that family or the things you just described? Because like in baseball, I know a lot of guys back in the day were doing cortisone shots, and like those would work.
I've taken a cortisone shot before.
Well, what was your experience?
To me, all it did was just numb the pain away. Like it takes all that pain out. And then, what ended up causing, I did it in my shoulder actually. And that's when I led to the stem cell was I did the cortisone. Everything made me feel like unbelievable. You feel like you're on top of the world. You don't have any pain. When technically I actually kind of made things worse because the pain was from my shoulder, which I had tore part of my supraspinatus. And so I had dealt with that, but all I was doing was actually increasing the tear. Yeah. So then I ended up getting the stem cell into that to cause it to heal back up and help with everything. So,
well, because you can't feel the pain, that probably, sets you up for failure in terms of hurting yourself even more.
Right. Because you don't notice it.
Yeah, exactly. Yeah.
And also actually, if you inject the steroid into the tendon, it weakens the tendon and you can actually tear it even more. And so if you're going to use a steroid, well, you shouldn't anymore now that we know. But what they used to do in the past is that actually, inject it into the joint, not necessarily into the tendon. And so we don't utilize, at least in my clinic, we don't inject joints with the even cortisone or steroid, because we know the long term it's a cytotoxic to the cartilage, so it's actually going to accelerate the degenerating process, so that you would develop arthritis further in the future.
So maybe that's what it is, because I've heard from older ball players that had done it in the past. They had actually had so many cortisone injections that it actually caused that area to go really stiff to where they lost mobility in there, because and would that be the stiffness be associated with arthritis at that point?
Because the cartilage is gone. Okay. Right? The cartilage is, like you break the chicken leg and you see that white surface on the joint. And then once that's all worn out, it doesn't glide very well, right? Yep. So it's like having a sandpaper rubbing against one another. Oh. Right?
Yeah. Yeah, and it's the other thing too, I noticed you were saying it with the stem cells, with the steroid, with the stem cells that I'm doing, that I did, I shouldn't say I'm doing. there was definitely no steroid involved in that. Same thing with the PRP too. Is that just something that's part of the procedure? Is that something that you add into it, or?
So steroid is a very strong anti-inflammatories, and so you do not want to mix that with the PRP because you want initially a local inflammatory process so that your body can heal. So adding steroid, So naturally. So adding steroid to the stem cell site or PRP site, it's counterproductive. So it's something that you definitely don't want to do. And then there's the besides a platelet-rich plasma, then there's a whole family of stem cells. And because it's becoming a lot more popular, so there's some misconceptions and misinformation out in the public what really stem cell is. And so stem cell can be harvested either from your bone marrow and typically from your hip because that has the greatest concentration of the mesenchymal stem cells. And then you can also get it from the fat derived. So you do a little mini liposuction and then you isolate the stem cells. And then there's, like what you talked about, the umbilical cord or placenta driven. But, the umbilical cord, what we found is that it's really not a stem cell therapy because, once they draw the blood and then isolate it and then send it to the clinic, the viability of the cell is less than 50%. And of that 50%, only a very small percentage of them are actual stem cells. So it's more of a growth factor treatment. And unfortunately in Texas and general population, that has become really popular. I'm not saying it's not useful because, just like it helped you, it does help a lot of people. Technically, it's not stem cells. And you can order the kit from any laboratory. And it's being done a lot in the different chiropractors' office. And a lot of them without having a full knowledge of the true stem cell research. And they can't do the injections themselves. So they hire PAs, physician assistants, or nurse practitioners, or family practitioner doctors into their office, and they're providing those injections. But if without the imaging guidance, whether using the ultrasound or floor scan, you can't inject it into the right location. Right. So then it becomes completely useless. Right. And if somebody's getting better, it may be just a placebo effect. That is happening all over the United States right now. And FDA should be cracking them down by end of this year. But that's what's being practiced. But the umbilical cord product is more of a growth factor. So it helps you heal. Same thing with the stem cell. It helps you heal. But there's, I just want to clearly make a distinction between the stem cell and the growth factor treatment.
So just to kind of, from a basic concept, because that really sounds like the kind of the procedure treatment side of it. Mm-hmm. In the most basic, way that you can put it, what it actually is happening, though, like what makes a stem cell? Because I think kind of the way I heard it explained, and I could be wrong on this, is that it's a little bit like almost it's a concentration of cells that almost don't have an identity yet. Mm-hmm. And depending on where you target those, mm-hmm. Cells without an identity, they then take on the identity of mm-hmm. the cells around them in that same place. Is that pretty accurate?
So that is the general idea about the stem cell, is so that it's a type of cell that hasn't fully differentiated, right? And then it has the ability to turn into muscle cells, the tendon cells, ligament cells, cartilage cells, or bone cells. So that is part of it, but that's not the whole story. So especially for musculoskeletals, for like athletes and then also arthritis, we're looking for specific type of stem cells called mesenchymal stem cells. The scientist who discovered the mesenchymal stem cells, he said he mislabeled it. It's really a messenger cell. So there is some aspect that cells does become cartilage cells or ligament or tendon cells. But what it really does is that when it's in that specific environment, the cells communicate with one another. And then it starts to send a signal to the local stem cells so that it can help start to regenerate and repair itself. So it has the growth factor that comes out of it. So it's more of a communicating type of cells. So it's not, simple way of describing to the public is that, we get the stem cells and then it's going to turn into cartilage cells. That's really not necessarily the truth. Gotcha. Then we harvest the stem cells. It has the ability to send a signal to the local cells so that local stem cells can repair and regenerate itself.
Gotcha. Okay.
Yeah.
Did you get all that, Derek?
Yeah, I was going to say, I for me, I mean, there was a lot of benefits to it. It definitely helped me out, get back on track with everything. I mean, to heal up the way it did with the injuries that I had in my shoulder. And then obviously when I had the knee surgery, they put the PRP in there as well. I mean, those things helped out a lot. And I don't think people understand is how beneficial this stuff really is.
Derek, how quickly did you feel the effects of that treatment? Like you go in, they do the treatment, and then like...
For which one though?
I guess either your shoulder or your knee. I mean, I guess they were different experiences. Yeah. Well, give me the best example that had the best outcome and experience for you.
Well, I mean, they're both great. So, I mean, I could tell you both. With the knee, once I had the surgery, I had to redo everything. I had to learn how to basically walk again and get all that because there's no pressure on the knee. Because you're, like Doc was saying, you got to keep it from letting it, when you put it in, you don't want it to squirt out.
You getting emotional?
What it is, because no, I did. It hit a soft spot. It's my turn now. I had the hiccup there.
I didn't know if you were getting emotional, man. My bad.
It's a serious subject. But it's one of those things that you were told when you had the surgery, and he's going to easily be able to relate to this. Is you can't have the pressure. It's just like we talked about with the back. You can't let you can't let them collide down because it's got all that stuff, the juice, the liquids, all the stem cell, PRP, all that in there. And with that, I was being told pretty much that I wasn't going to, it was best that I wouldn't be squatting anymore or doing certain activities. Well, it's helped me so much that I'm back and doing all the normal activities I was doing before. I'm squatting and I'm doing my regular leg workouts that I was doing when I was, before I got hurt. With the stem cell in the shoulder, that you take, when I did it, I had to take 5 days of completely no throw. And making sure that there's no, activities. And then kind of once the 5th day hit, you start doing your shoulder routine just to kind of get things going so that the grinding of it could go through so it knows what's going on. Cause by that time it's already attached. They say by day 3, it's completely attached to what it was going for. And then it starts doing its work. Like it's just like everybody just takes off and does their thing, building back up what was damaged.
Where did they inject it? Did they inject it directly into supraspinatus?
So I had one go right into my armpit. So it went through my armpit. The needle was probably, at least, pretty long to where it went. It was in there, and I hate needles. So I got to look for a second, and then I was over it. I didn't want to stare anymore. And then I had one on the back of my shoulder. So behind, so I had underneath the armpit and behind my shoulder above my lat. And like I said, the process was just a few days of no throw, no activities with it. Yeah. I will say I was pretty sore just for the time being.
Like from the procedure itself?
Yeah, I was definitely more sore though from when I did the PRP, both from my hip where I was, they pulled the blood, and then also in the shoulder area to where laying on it was probably the worst thing in the world. It felt like my arm was just going to rip off at some point. I was in so much pain.
Like the soreness after a stem cell therapy, or
so when you did
stem cells
shoulder,
a little different,
was it just umbilical cord, or did they draw blood from you, or did they get bone marrow?
Well, I've done both. I've done both in the shoulder, the PRP, and I've done the stem cell. The stem cell was umbilical, came out of a little tiny, little frozen jar, I should say. That I wasn't as sore. I think it was more of like the 1 day soreness. The PRP was a few days of soreness. And that, from what I've been told,
am I understanding
doing it in the past, it's sore.
Were you saying, because he's saying umbilical, were you saying that umbilical is technically not considered stem cell therapy anymore?
Yeah, it's technically really a growth factor.
A growth factor therapy.
Yeah.
And when you say, and that's really based on like the platelets being the growth factor, or
the platelet PRP is also growth factor treatment. So they're both the same. It just comes from a different place, right? And then when they did the injection, did they use imaging, either ultrasound or X-ray machine?
So they basically targeted, which was cool from my perspective, is to sit there and they had the monitor to my right, and they had the machine going, and I could see the needle go into the muscle. And you could see everything. Okay, here's the tear.
And you could feel it, I'm sure. Oh, well, they probably numb you up a little bit too.
Yeah, you're definitely numb. Okay, but you still feel a little bit.
It's kind of weird, right? Like seeing it on the screen and then feeling it at the same time. Like,
dude, it was the craziest thing because you're watching it, and the thing is, when it's in, you see them like telling you, okay, here's the muscle. This is where we need to inject. This is where the tear was. And then it was boom. As soon as they started to squirt it in there, you can see everything open up and all of the stuff come out. Yeah.
Man.
So that was, it's crazy to sit and watch that. But I mean, the time down, that's different from PRP. PRP, I was down at least 5 to 7 days. Stem cell, I was technically down 3, but I had to wait the 5-day process just to make sure everything's attached, doing its thing. And I started throwing, and when I started playing catch and everything, I felt like $1 million. Like it was, I literally felt like I had a brand new arm, is basically the best way you could put it. Like it's incredible. And the one thing Doc, you're gonna be able to correct me on this. When I first got the first stem cell, they were saying that there was about 10 million whatever it is in there. My second time doing it went from 10 million to, I think it was 35 million, maybe, or it might have been even more than that. And they said each time that if I were to continue doing it, let's say I did another one, let's say I was doing one tomorrow, there's probably more than that 30 million now. It's probably an up higher number of stem cell that's in there.
Yeah, I mean, you can order different size, depending on where you're injecting. You can actually order 10 million cells, 35 million cells, and you can also order 70 million cells.
I mean, how did they even discover the stem cell in the first place? Because it seems like a pretty unique thing that the body is just capable of having these. I mean, I'm assuming. I mean, if you think about it, just from like the embryo stage of like, is that a lot of stem cells like at that stage in terms of birth? I guess conception. Like, is as an embryo develops into, I guess, a fetus and then turns into everything else that we got going on, is that all a byproduct of the stem cell process?
Yeah, the stem cell is just the cell that has the ability to become anything, right?
So, but is that like what most of your cells are when you start out?
When you first start out.
Yeah.
What's amazing is now that they have the technology, it's not clinically available, but then now they can get a cell from your skin, which is fully differentiated into a skin, right?
It's a skin cell.
It's a skin cell.
Right.
But it has the same DNA. So your DNA is like a computer software. It has all the programs that you need.
Right.
But it's only expressing certain things so that it becomes a skin cell, right?
So like, would they alternate that skin cell with like something like CRISPR? Is that the way that they would do that?
Yeah, you can actually go back in time.
Kind
you
of
can
strip the identity, essentially?
Yeah, so you can go back and then make it into pluripotent cells. So you're actually reversing the cell to go back in time, essentially, and then have the ability to become anything it wants. So they have now been able to get the epithelial cells, which is a skin cell, and turn it back around and make it into a pluripotent cells, and then have it go into a different direction and make it into, let's say, heart tissue.
That's wild. So it's a whole nother way to essentially harvest these cells to use in the treatment of these patients.
And so that you can use your own cells rather than getting somebody else's. So eventually, let's say using skin cell as an example, and then send it to a lab, and then they may be able to make it into a heart tissue.
Wow. Okay.
The other thing too, I think people don't understand, and you may have said this already, is with the stem cells, they literally go to what is damaged rather than like sometimes when you put like a PRP in there, it just hits a broad area, whereas the stem cell goes directly to the target. That's one thing that I think it's very, that people I think should know as well when you're doing something like this is it's going to go exactly to where it needs to go to fix that area. Yeah. I mean, which is crazy. It just shows how smart this stuff is.
Yeah. I mean, that's what happens, when we're injecting, like for example, somebody with I did a patient who had a meniscal tear, it's a horizontal tear, and they really didn't necessarily need to have the surgery. If they do, they'll just take out the meniscus, and then they would, advance the degeneration. So we would inject it into the knee, but unfortunately the knee is a large joint and it can go everywhere. However, there are enough that goes into, because there's a certain signal that is sent out by the damaged tissue inside your knee, and that allows the stem cells to congregate itself to near the meniscal tear and then start to repair itself.
That's crazy.
Yeah. So
it's just stem wild that that's even crazy. Possible. I mean, when you think about it, I'm sure if you would explain this concept to someone, early 1900s, they'd probably be sitting there like,
Yeah.
You're crazy.
You
That
are
sounds like
definitely crazy, right?
Witchcraft.
Yeah.
Well, we've evolved so much from that time. Just think of what the doctoring, the medicine and all that stuff from back then to now.
Just imagine what the world is going to be like in 50, 100 years, right?
I mean, it's insane. So in your, with what you do, obviously it sounds like with your spinal practice, you're kind of usually making a decision, probably like, is this person a candidate for stem cell therapy, or is that not really an option and we have to go do the minimally invasive surgery? But what, I guess, ratio do you see where it's like, okay, because I'm sure it's got to be music to patients' ears hearing that they don't have to do surgery. Granted, it's minimally invasive, but to not have to go through a surgical procedure, other than, is it just an injection most of the time with the stem cell? What ratio of patients do you see where they actually get the benefit from the stem cell? And like, kind of what's the qualifications to be a stem cell candidate versus an operation?
So it depends on who they are. So I see spine surgical patients, but also I see orthopedic patients who doesn't want to have surgery. So I no longer do orthopedic surgery, like let's say knee replacement or rotator cuff surgeries or total hip replacement. However, patients do know that I do stem cell therapy, so that they come for consultation to see if they're potentially a candidate. And so in looking back at our group of patients, over 80% of the patients have been able to avoid, total knee replacement. They've been told that their knee is so arthritic that they need a total, cut out their knees and then replace it with the metal and plastic. And those patients, 80% of them have been able to avoid the total knee replacement 5 years out. And the hip replacement for approximately about 75% of the patients being able to avoid the total hip replacement. Wow. And some of the patients, and their bone is bone on bone, right? And it doesn't. I want
to say Mel Gibson's dad, didn't he? I could be wrong. I think Mel Gibson was on Joe Rogan's show and he brought his dad on, and he actually had that exact procedure in terms of stem cell for his hip. That totally changed his life in that regard.
Yeah. And so a lot of patients, I mean, that's what's amazing, is that technology is, evolving. And so that I think in about 10, 20 years, the traditional conventional orthopedic surgery is going to be just history. And I think over 80% of the orthopedic surgery will be replaced by, what we call intervention, kind of like the cardiothoracic surgeons, heart surgeons. They can't find a job anymore, right? Because, not many people need actually open heart surgeries, because cardiology technology has evolved so much.
Isn't that crazy? Because they probably were one of the most valuable surgeons in general at one point, right? And then technology kind of comes in and says, not anymore.
You're no longer needed, because the cardiologists are able to place a stent.
Right.
But, that kind of also goes into, the study that showed whether you have an open heart surgery or whether you have a cardiac stent placed, it does not extend your life, because most people don't change their lifestyle.
Right. Because it's just really putting a Band-Aid, like a temporary Band-Aid on the problem. But if you're not changing anything about what you're doing, what you're putting into your body, your habits, etc., then the same problem is just going to reemerge, and it's probably going to be worse than it was before.
Very quickly. And so unless you change your lifestyle, then you're really not expanding your lifespan at all.
Well, I think that's a good segue right here. Derek, are you ready to get tag teamed on the plant-based vegan nutrition conversation?
Well, I want to go back, because I was intrigued by something that you brought up. As you were saying, somebody was basically on bone with their knee. Is that what you were saying?
Yeah.
So as somebody like myself, who I've seen my MRI, and my one knee has a little bit. It's close to being. It could be a bone on bone at some point down the road. But is that something that I should look into as well, as with the study that you guys got going there?
Yeah, and the best outcome is actually the prevention, right? So most people are not going to necessarily have a stem cell therapy, because currently it's not covered by the insurance. They're not going to do it until they're in significant amount of pain. However, it works significantly better when your knee is not all the way to bone on bone, right? And so I think the stem cell therapy would work the best in the preventative sense. And then, of course, it certainly helps once somebody has a significant amount of arthritis or significant amount of musculoskeletal damage. However, the best scenario is somebody who may occasionally have some symptoms, but they want to do it for prevention. And that would be the best
So I'm probably
case
too
scenario.
late is what you're saying.
No, it's never
No,
too late.
he's
right?
saying that if you to address it now, you said that you're not bone on bone right now, right?
Yeah, not
Yeah.
yet. I mean, it's close.
Yeah.
We're
Yeah, so he's saying if
I mean, at some point
you were
it's
to
gonna
come
get
in,
there.
you'd be coming in from a preventative standpoint before it gets to that point, and that's what you would want to do.
Yeah, because what you're, you got to think about what your knee is going to be like 20 years from now, 30 years from now, right? And so
When you're a grandpa,
yeah.
yeah.
And so what do you want to do about it now to help prevent that? And just like, we tell people, you want to prevent heart disease rather than trying to reverse the heart disease. It's easier to prevent it than reverse it. Same thing with the stem cell therapy. It's easier to prevent severe arthritis by, having the stem cell therapy rather than trying to reverse the process after it's bone on bone. Does it help? Absolutely. I have a series of patients who has a bone on bone, a knee, been told by multiple orthopedic surgeons that said you need a total knee replacement or total hip replacement. After the stem cell therapy, they've been able to avoid total hip or total knee replacement for 5 years out. Right?
Wow.
And then think about those type of surgeries that if you have a knee replacement or hip replacement, chances are every 10 years, you're going to have another revision surgery. You have to replace your replaced knee because all man-made products, it's going to fail eventually, right? So if you're more active, it could be potentially every 7 years. And if you're not as active, it could be 10 to 12 years. You have to rip all the metal apart again and then place a new one. So if you're and younger people are getting total knee and total hip replacement. And if you're age 50 and have a total knee replacement, then you have to have another one at 60, another one at 70, and potentially another one at 80.
Yeah, that's not a good situation.
Not a good situation at all.
Well, then I better catch this one real quick.
Well, it sounds like we need to do an on-location podcast with you at Dr. Juan's office, and let's just get the behind the scenes of what this.
I'd be okay with that. I would do it in a heartbeat. I mean, it's something it's my future. I got to take care of myself at the same time. So,
well, preventative is always the best way in general. I mean, even when it comes down to, and I'm segueing here, definitely segueing.
Yeah, I know. I know where we're going here. Yeah. We're going to our plant-based diets, everybody.
Hey, look, just I want to say it's good to have you on the team right here. We're going head-to-head,
2 versus 1
with, and I'm going to defer to Doc, as you call him. Oh, real quick, before we go there, I do have.
Yeah, go ahead. Tell us, Marty.
I do have a question because I did think of this before. So, and it's because I just saw a recent video that was really funny. The video was this teacher I think he was at a high school, and what he did as a kind of like and the video went viral. If you haven't seen it yet, but he went into other teachers' classrooms, had his phone rolling, videotape. And still say videotape. Video, yeah.
Good job, Marty.
Get the VHS rewinder out.
Yourself.
Yeah. But it was funny because what he did was he went on with his phone, videoed in each room, and he called the teachers by their first name, which in a school setting, you just got to think like teachers almost never get called by their first name. It's always Mrs. or Mr. So-and-so, right? And like other teachers, when they talk to students, they typically refer to the teacher by that same type of scenario. So like the reactions were priceless. Just seeing these teachers' reactions because he's coming in, he's like, "Hey, what's up, Bob? Dennis, what's going on, man?" And like they're just looking at him like, "What did you just call me?" So reason I'm bringing that up is as a doctor, obviously you probably deal with that same scenario. I would assume, and I'm totally making an assumption because by the way, guys, I'm not a doctor. In case you didn't know,
Play one on TV.
Yeah, I could play.
But he
one
did
on
stay
TV.
at a Holiday Inn Express last night.
There we go. You're correct. But is that a thing where, like, are you like your name's Douglas Juan, but are you offended when, or maybe not offended is the right word, and maybe it's different person to person, but someone doesn't address you as Dr. Juan? I'm sure maybe it's one of those things in the office. It's probably more focused on, but maybe outside the office, like you're out at dinner and. We were out at dinner the other night, and the chef came out, and he said, "Doug, what's going on?" He didn't say doctor, but like, is that cool? Like, how does that
totally
work
cool,
in the doctor world?
I'm very casual. I tell you, my first probably 5 years, it was so weird when people were calling me doctor.
Yeah.
Right.
Yeah.
And so it was something that I had to get used to. And I'm very, very casual. So I would rather people call me by my first name or, whatever they want to call me. And I don't, outside the hospital setting, I would rather not people call me Dr. Juan. Sounds so formal.
So can I have permission to call you Doug?
Yes, absolutely.
See, okay, I want to give my reasoning though. It's like, so when we see people in the sports world, nobody calls them by their first name. It's either Dutch or, guys on my team, Longo, Belt, you call them by their last name. And then when we see our doctor, we call him Doc. We just literally say, hey, Doc, Dr. Murray is one of our doctors. So it would be Doc. Hey, check me out. I think I've got this. So that's where the whole doc thing comes from for me, is you'd always just, Dr. Keith Meister was the guy that did all my surgeries or my surgery and helped me out in Texas. It's doc. I mean, that's just something that we've always done, was just saying that. Now, if there was another doctor sitting here, then I would say Dr. Juan, or I would say Dr. T,
Dr. T sounds like a good, and I feel like if he was
it sounds like a drink, actually.
Dr. T, if he was a WWE character, superstar wrestler, then I think he might be the Doc.
The Doc.
Oh yeah, he would be the Doc.
What would his finishing move be?
Gosh, I'm trying to look at.
See, this is where you're supposed to shine.
Bring out my scalpel.
Bring out the scalpel.
This is the scalpel. I don't know. I mean, that's where you get to be.
Surgeon. What's the guy from Mortal Kombat that would just like rip out the dude's spine in Mortal Kombat? That's his like finishing move. You don't know?
Yeah, I don't know. I don't know that one off the top of my head.
All right, cool. Thanks, man. This is great.
I love Mortal Kombat, but I don't know.
You don't remember that? Don't you? You know what I'm talking about?
Remember
there was a character on
my
Mortal
character.
Kombat. That was his.
My favorite character is Sub-Zero. I'm just Sub-Zero. That's all I care about.
All right. Well, thanks for the contribution. You shined like a bright star there.
I froze, bro. That's just how it was. Sub-Zero style.
Talking WWE, I think you're gonna nail it, and it's like your strongest subject, and you just totally dropped the ball. It's all good.
I mean, he's just gonna send him to the hospital. That's all it is. Every time he does something, you're going to the hospital.
There you go. Like they take his opponent out on a stretcher, like with.
Yep. Right on the ambulance. He gets in an ambulance. They're gone. Tap on the window. See you later.
Nice. So on to the plant-based nutrition. So this is like very interesting to me. I know it's going to be interesting for you too, Derek, as an athlete. And then also just get back to Jason Cook. You got a little taste of what it was like to, go vegan and be on a plant-based diet. But kind of what we talked about earlier, how we initially had met was through Clint telling me about your Facebook group. And the Facebook group, for those who don't know, it's called Whole Green Living Plant-Based Nutrition. Just go on your Facebook search bar. Derek, you're going to join the group tonight. You're going to be the next newest member of the group. But it's
I'm going to do it as we speak.
Okay. Well, there we go. Get distracted. It's the but it's a great place. But tell us a little bit about maybe even before we get into the group, let's just talk about kind of your journey into the plant-based diet and what kind of sparked that. You mentioned earlier you're exposed to a lot of radiation and the smoothie that you drink every morning, you refer to it as your anti-cancer smoothie, but kind of what brought you here to being on a plant-based diet? Because you weren't always vegan, right?
Yeah, I wasn't always vegan, but I originally grew up in a vegan setting. My family's Buddhist.
Okay.
And then a lot of my mother's side, the relatives are Buddhist monks.
Okay.
And so they're naturally vegan.
Oh, okay. Right? I did not know that.
For the compassion. But growing up, though, I wasn't necessarily vegan. But also at the same time, I really didn't like eating meat. And especially when it,
Was that like even at a young age? Or?
At a young age. Because, I loved animals and just compassion for the animals. But then after moving to the States, kind of forgot about it. And then I was a vegetarian for a few years. But when I went to college, in 90s, there was absolutely nothing to eat at the school cafeteria. And I was starving, just eating salads every single day. And that was about it. And then I finally gave in and then started, eating meat again. But the real big change came about when I started seeing some of my colleagues who's been passing, from different sort of cancers. And as I was saying before, with minimally invasive surgery, we use a lot of intraoperative X-ray machine. Even though you can't see it, your body is being poisoned. And we're certainly protected with the lead vest and lead skirt, and then the thyroid shields, and then lead glasses to block out the radiation, but it's not 100%. And when you're busy and you're constantly being exposed to the radiation, eventually you increase risk of developing I call it clinically significant cancer, because we all have cancer cells. You have cancer cells in your body. I have cancer cells. Derek, you have cancer right now, right? Our immune system is every single day fighting it. But then if it misses that one cell becomes 2, 2 becomes 4, 4
like,
becomes
is this
8.
when you say that, is that even like in like younger people, even like in their, you know, a 5-year-old or a 10-year-old or a 15-year-old, are they also having cancer cells in their body as well?
Yeah, less likely,
right?
But as you grow older, you get exposed to different kinds of environmental toxins, or you know, exposed to the sun. We need sun, but at the same time, overexposure creates too much radiation, and then causes a DNA damage, right?
Gotcha.
So as you get older, your cells become less stable. So then we're constantly fighting our body to, you know, and killing off the cancer cells. But what I noticed, some of my colleagues were passing away at early age with different sort of cancer. Then I started diving into, I want to make sure that I want to prevent cancer. And that was my mission. And I just dove into reading just, you know, thousands of scientific papers, trying to figure out how can we prevent cancer? And if you do have cancer, how do we reverse it? And then through all that research, I realized the best diet and lifestyle, because it's not just the diet. Diet plays a majority role, but it's also your lifestyle. It is that whole food, plant-based nutrition and lifestyle.
And what's the difference, just for people that know, there's you know, plant-based, which I would say, just being fully transparent, I would consider myself obviously plant-based and vegan, but I'm not probably adhering to all the differences when it comes to the whole foods plant-based living. So what's the main difference when you say whole foods plant-based living?
Yeah. So just because you're vegan, it doesn't mean it's necessarily healthy, right?
Right.
Because Oreo is
well, we
vegan.
got our junk food vegans, is I think what a lot of people call them, right?
Yeah. Potato chips is vegan. And so those individuals, they do it mainly for compassion for the animals, which I think it's, you know, for ethical vegans, I think it's extremely important.
Yep.
However, at the same time, for your health, you really want to focus on the whole food plant-based, which means you're not eating any processed food. And then you're trying your best to eat food as it was grown. So that's the whole food, right? Eating an apple rather than eating applesauce, right? And because it contains, it's less processed or not processed, it contains the nutrients as it was grown. And also oil, as a perfect example. Oil causes significant amount of inflammation. It's filled with saturated fat, and it's processed. And so not adding oil to your diet, right? So
I think oil in general, I think, is one of those things, like when it comes to cooking, because I cook a lot. I always heard growing up, like, there's different levels of oil and quality. So you can use vegetable oil, which is, you know, considered very low quality to like the average person, or you could use something like canola oil, or even like they've got, you know, basically there's sunflower oil, avocado oil. There's all different, you know, types now to cook with. And a lot of them are marketed and branded, you know, olive oil gets, you know, usually takes the cake when it comes to being like this healthy oil. But I think, you know, even just being at your talks that I've, you know, attended, even olive oil really is just as bad as any of the other ones, right?
Yeah. So if it's an extra virgin olive oil, first, you shouldn't cook with it, because most people don't realize it. They think that it's just because it's an extra virgin olive oil, which is healthier than just regular olive oil, that they could cook with it. Olive oil in general is very unstable. So if you heat them, it breaks apart and it causes oxidative stress. So if you're going to use olive oil, or more likely extra virgin olive oil, then you should use it in a setting where you're not cooking it, whether it's you're dipping the bread, or, you know, sprinkling it, not just dousing on your salad, right? And that's where a lot of people gain the calories from, right? And so
that's me. Yeah.
And then there's, you know, certain oils are healthier than the other, but none of them are healthy, right? Because they tend to have a lot more what we call omega-6 versus omega-3. Those are the fatty acids, and it leads you down the path of creating a greater amount of inflammation in your body. And so, but, you know, through this whole process, I realized that the whole food plant-based was the best way to avoid cancer. But then further into the research, realized it was the answer for preventing heart disease, right? And reversing the heart disease. Only a nutrition plan that has ever shown to reverse the heart disease is a whole food plant-based nutrition.
and this isn't like something like when it comes to reversing the heart disease or really reversing any of these other scenarios, because I know, just through your talks, there's all these cases of reversing type 2 diabetes, right? And then also in the type 1 scenario, not necessarily reversing it, but keeping it at bay, and keeping it under control through that type of diet. But there's all these other conditions, medical conditions and diseases that can either be reversed, terminated, or kind of, stopping from them developing any further, depending on what it is. And I think that is, what I was starting to say is that it's not just like isolated cases. Like this has been proven to be, fact. And it's not like just, a bunch of hippies saying, hey, let's save the planet. There's people's lives actually being saved, from this. And I think you've experienced personally, just you from the Facebook group and different people's testimonies, which I would love to hear some of those examples. Another one I think that would be great to share that I heard it when you were talking about the heart health was, I don't remember if he was I want to say he was like the head of, was it the American College of Cardiologists. Right. Dr. Right. And that's such a great story, but I know I gave you a lot to kind of work with there, but I think it's important just for people to hear these real life examples and not just go, oh yeah, this definitely helps and it's going to improve your health. But here's real life examples where people's lives were literally saved from this lifestyle and this nutrition.
Because 80% of the chronic disease, chronic disease is what kills people, right? 80% can be completely prevented or suspended or reversed. And what most people should worry about, number one, is a number one killer of Americans and the rest of the world, which is the heart disease, right? Over 800,000 people die every single year from cardiovascular disease.
800,000?
800,000,
wow.
Right? And so 1 in 4 Americans die from heart disease. And it's completely preventable.
Is that the number one cause of death from a medical standpoint?
Yes.
Heart disease? Okay.
It's a number one killer of Americans. And whether it's medical or not, it's a number one killer.
Number one, period.
The number one, period, is the heart disease. And heart attack, I say, is a complete choice. 90% of the time. Nothing is ever 100%. 90% of the people who have heart attack, they choose to have a heart attack.
Right, which a lot of people don't want to hear that, though, in terms of it kind of can, I don't want to say it's offensive, but when I'm sure that, because I've heard you say that at some of your talks before, and that could probably rub some people the wrong way, not intentionally.
Somebody told me to fuck off one time.
Doc, this is a kid-friendly environment. Can you please not fucking cuss?
And somebody.
So seriously, somebody just told you that, like, fuck off. That's a choice.
Yeah, I think it was a Facebook comment. Like people are empowered, right? Behind the
keyboard warriors.
And then they said, some people said I was really insensitive, but that's the reality. You can't dance around it. And people just don't get the idea.
Well, it's a very serious topic. Your heart's nothing to play with at the end. Really, your health in general is nothing to play with. But when it comes to your heart, that's your ticker.
Because if you have a heart attack, chances are most people will die.
Yeah,
most people would die, right? And so but the sad thing is it's completely preventable. We spend over $80 billion a year, every single year, doing stents and open heart surgeries, and it's completely unnecessary. Baylor Heart Hospital, which is one of the best heart hospital, and over the past 10 years, they've spent $500 million in expansion. When there's a technology, which is produce section in your grocery store, that can completely prevent and reverse the heart disease, but that's not their goal, right? All those big hospital systems, their goal is to do the surgeries, do the procedures. They can make millions of dollars.
It's a business at the end of the day. And
exactly.
A hospital, and I heard you say it one time, hospitals with the technology and the understanding of how like nutrition can really fix a lot of these problems. Hospitals shouldn't be expanding, but they should be getting smaller.
They should be smaller with the current technology, right? But have you guys ever eaten at the hospital cafeteria? It's poison.
It's been a while, but you show on your Instagram pretty often, not just what they serve for the patients, but then also what they serve the doctors as well.
Yeah, at the doctor's lounge, and for breakfast they're serving bacon and fried eggs, and then for lunch they have processed meat. And it is literally junk and fried chicken. I've once taken a picture of a cardiologist eating fried chicken.
Right.
I say, you got to be freaking, since this is a children's, episode, I said, you got to be freaking kidding me, dude.
I scared you on that one. I'm sorry.
I said, you got to be freaking kidding me. Are you serious? And then so I said, can I take a picture of you eating a fried chicken?
Right.
And then he said, you better not. I just took a picture just to, make a joke out of it, to mess with the guy. But most people didn't think about the consequences. That's why I post pictures. I mean, you've seen it in my Instagram. I go to the doctor's lounge, and then if they, every day they're serving poison to the doctors, and then the regular cafeteria is worse, and I take a picture and I post it just to let people know that hospital should be a place of healing, right? And fixing people and curing people. But then, once I also had a patient after the surgery had a mild heart attack, and then we consulted the cardiologist. Next day, I show up to round on the patient, and he had a bacon, an egg, and then
the guy that just had the mild heart attack
a heart attack the night before for breakfast. That's what they were serving him.
Wow,
right? This
probably
is
not
crazy.
what you want to be putting in your body right the day after a heart attack.
Yeah,
because really, that's probably what put him there in the first place, right?
Exactly, right? And so knowing that now we have a treatment method, which is simply a diet and nutrition that you can actually reverse the heart disease. And I've shown you some of the slides where, I have a slide from the chief of breast surgery at Cleveland Clinic, which is one of the best heart center in the world, right? And he had such a massive heart attack they couldn't do stent or they couldn't do bypass
This is
surgery.
while he was actually on a shift, right? He was at the hospital, right?
So he was at the hospital. If he wasn't, he would have been dead, right? And so after the long day of surgery, he was in the recovery room writing orders. He had a massive heart attack, and then he died about 3 separate times, but they were able to revive him. And then afterwards, they said, well, we can't do the surgery or place a stent because the extent of the atherosclerosis he had. They just had to medically manage him. And he was depressed because that's essentially a death sentence.
Right.
So he thought. So then, he ran across Dr. Esselstyn, who worked on the same floor. And Dr. Esselstyn, who's a pioneer in the whole food plant-based, said, hey, you got nothing to lose. Why don't you try plant-based and see what happens? A year and a half later, he went back to the cardiologist and then had a cardiac cath done. His heart looked like he never had a heart attack.
All from just switching to
all
a
from just
plant-based
purely switching to plant-based
and
nutrition.
this is, and like you said, this is a guy that essentially was given a death sentence by saying, hey, we can't really do this procedure because the damage is so bad at this point. We just got to manage you to the point where you die. Keep you comfortable, right?
Yeah, exactly. And so if the chances are most people are going to die from heart disease,
and
right?
Is he still living today?
Yeah, he's still alive today.
Wow, that's insane.
Yeah. And so shouldn't that be
that's crazy,
the standard, right?
I mean, it's really crazy. You got me over here thinking about every single thing now.
Yeah.
Questioning what my eating habits, obviously.
Well, like what do you typically eat, Derek, on like any given day? Like, well, I know you have your routine that you do before a game.
I'm always eating pasta. Night before I pitch, it's literally any kind of type of pasta, basically. Chicken Alfredo, basically, would be what it would probably. Yeah, it would come down to something like that, something along those lines. Spaghetti, whatever, anything Italian, basically, is what I eat the night before I pitch. And then when I get to the field, it's pretty much the same thing. I'm probably going to eat chicken, which I know there's arsenic in there. So I know, that's something that you guys will probably talk about. But I mean, I'm eating your carbs and all that too, the potatoes and, basically stuff like that. Keep me going.
Well, maybe you could give some examples, because I think this is just good, not just for you, Derek, but just people listening in general, kind of what the different things that you can eat as, like from a meat consumption, whether it be fish or, red meats and chickens, because there's kind of, I don't want to say levels to how bad some of the stuff is in comparison, but some stuff is worse than others for sure, and great to eliminate, but kind of why they're bad. What exactly happens when I consume red meat that makes it bad? What happens when I consume chicken that actually makes it bad for my body, or dairy, and how that kind of works for just the average person listening right now that might not have any insight. Yeah,
the first, as an average, Americans consume about 225 pounds of meat every single year. That's
per person?
Per person. That's a pretty tremendous amount, right? So since I'm not eating it, somebody's eating, 450 pounds of, meat every single year.
Yeah, somebody's doubling up.
Yeah, somebody's doubling it up. And so that's part of the reason. And then it's, inclining every single year, right? And then meat consumption is just exploding. If you look at before the 1950s, most of the disease that we have today didn't exist. The number of the cancer incidents were significantly lower. Even the heart disease was lower. All the autoimmune disease, you hear about people having rheumatoid arthritis, ulcerative colitis, Crohn's disease, Hashimoto thyroiditis, and lupus. All those did not really exist before 1950s. And with the invention of the processed food, and then also along with the meat consumption, those diseases have inclined significantly. 80% of the American population is either overweight, obese, or severely obese, right? People are just getting fatter and fatter and fatter every single year, right? Greater than 50% of the kids, teenagers, are overweight or obese.
50%?
Right? Over 50%. And then, so general population-wise, 80% of the Americans are overweight, obese, or severely obese.
80%?
Yeah, 80%. And
but do you also think some of that's factored in by playing video games and staying inside, not doing your normal activities?
That plays a part of it. However, at the same time, 90% of being overweight is due to nutrition.
Yeah, it's diet.
True. True. I agree with you, but I just think another thing that's happening is you see a lot more, like, think about when we grew up, we were outside being active. Yeah. Whereas nowadays you got like Fortnite that kids are hooked onto, or whatever, a gaming system as well. I mean, I can't say I don't play video games either, but at the same time, I do stuff during the day to keep me active.
You're a professional athlete at the same time. But I think to your point though, like, diet is one of the most important factors. I saw it myself. Like when I ended up going, all the way plant-based, I hit a peak of weight at 225. I'm 6'2", so I can stretch it out pretty well, but I ended up at 225, looking in the mirror going, man, I felt overweight and looked overweight. And within about, I would say, let's just say about 8 months or so of going all the way plant-based, not doing anything different when it came to, I didn't start working out, or, I would occasionally go on a walk, with Gina, or, that kind of thing, but nothing strenuous. Mm-hmm. I ended up going from 225 in about 8 months down to 170, which then ended up at about 2 months after that down to about 164. And 164 was like my high school playing weight when I was like a junior and senior in high school. So I wasn't doing anything different other than just changed my diet, went all plant-based with it. And it literally was like, it just fell off. Like I wasn't even trying to lose that weight, which was kind of the crazy part about it. Cause Gina and I, like when the weather's good, we'll go out and we'll walk towards the lake, and I'll see all these people, running and huffing and puffing, and which, don't get me wrong, I think exercise is great. And I know that you'll back that up. It's a really important part of the lifestyle change that you described. But at the exact same time, I see these people just, straining themselves to try to drop these pounds. You even see people talking about on social media and Facebook, like, in a month, 2 months, I was able to lose 5 pounds, which great, congratulations. But you probably could have done a whole lot more than that if you altered your diet. And I just want to yell at these people when I see them on my walk, like, change your diet and you don't have to do that as much.
You can't outrun a bad diet.
Right. Yeah.
Right?
That's true.
That's a good point.
No, diet, you're 100% right. I know for a fact that diet is a big time reason for a lot of these things. But I just also feel like your diet's not just going to take everything out. It does help a shit ton. I'd say if you're going to talk about just diet being the number one, I bet 65% of it is diet, and the rest is physical activity and whatever else.
What would you say? What percentage breakdown? Like from a diet to, like, what would the ratio be just in terms of, being at your peak optimal? And maybe it's not even a ratio, honestly. It might just be like each one is its own.
Yeah, each one is own. Let's say if you're thinking about weight loss, right? If somebody is overweight, they want to lose the weight, it's 90% diet and 10% exercise. However, for achieving the optimal health, each plays something different. I live by something I call PEAR life, right? The PEAR. To achieve my goal personally is to live until I'm 120 years old, not just a lifespan, but health span, living healthy. What's the point of living if you're in a nursing home, half dead, don't remember any of your family members. You're just existing. You're a vegetable, right?
Right.
That's not the way I want to live. I want to live until I'm 120 years old and live healthy as I can, and then drop dead when it's time to go.
Right.
So that I don't suffer. Right. So that's the lifestyle.
It's time to check out.
Yeah, that's time to check out. That's the lifestyle that I want.
Right.
So what I found was the plant-based nutrition, the best way to, number one, prevent heart disease, and prevent number two killer, which is the cancer. Right. And then the number three is the pulmonary disease. And so that's what I want to prevent. And then two is the exercise. And you got to exercise in order to prevent cancer, prevent heart disease, right? And so that's the best way to optimize the health, and then also to increase the health span as well as the lifespan. And then also we're exposed to so much toxins everywhere. So
the air we breathe and
what we breathe in, the chemicals that we put on, and then the plastic cup that we utilize, the bottled waters, and all those type of things. So now I have a second thought about what I consume, right? And so I try to avoid as much of the toxin as possible, right? And then the last thing is what I call restore. Restore is from stress management to sleep to love, and then get social engagement. So all these thoughts came about when we were studying the people from the blue zones, the 5 cities across the world that had the most amount of centenarians, and how did they live beyond 100 years old? And why are they like 100 years old still just their muscles are ripped, and then they're still working in a farm, right? Yeah. And not sitting in a nursing home. And so
what's their secret?
What's their secret? Yeah. And their commonalities were
and sorry to interrupt. You said that was called a blue zone?
Blue zones.
Okay.
Yeah.
And that just means these are super healthy areas of just containing super healthy people geographically.
So Dan Buettner, working for National Geographic, they gave him a task to find the cities across the world that had the healthiest people and the people who had the most amount of centenarians, people who are 100 and up. And he found the Okinawa, Japan, Icaria, Greece, Sardinia, Italy, Nicoya, Costa Rica, and Loma Linda, California, and studied all the things that they have done, and then found out, what were the commonalities. And essentially that's what it was. I mean, they moved their body every single day. They didn't necessarily go to the gym and to exercise, right? But they all commuted from their home to their work, and they walked every single day. They ate 98% of their diet was plant-based. And then they, living in a very natural environment, they were able to avoid the toxin. They had a great social engagement. They made love, and they had stress management, and they meditated, and all those things play a significant role to optimize their health.
Right. So on just kind of one of the examples I want to give is like red meat, for example. Mm-hmm. What happens when you can, like in terms of inside your body, what happens when you consume red meat?
A great point. First, the processed meat is considered by World Health Organization Group 1 carcinogen.
And like, how relevant is the World Health Organization?
They're the organization that oversees the health for the entire world, right? The brightest of the brightest scientists, work with the World Health Organization to come up with certain type of categories and classifications. And so the Group 1 is cigarette is Group 1, plutonium is Group 1, right? And asbestos is Group 1.
Carcinogen,
which means it will cause cancer. So if you eat enough, it will cause cancer.
And that's like the high. I mean, you're grouping it with cigarettes and
asbestos.
That is the highest.
That's at the highest rating,
cancer-causing carcinogen.
So when you eat your bacon, think about you're eating carcinogen. When you think about eating salami, when you're eating ham, all those type of things, the process.
Gosh, those are good.
Yeah. And
that's a great point though. Not to interrupt you, but I always hear this just since I've been plant-based. It's like, oh, you don't like eating it? It's not that I didn't like eating that stuff. I thought that stuff tasted great and it was phenomenal. Like I fully enjoyed every steak that I ever ate from a flavor standpoint and just general consumption. But it's when I learned what could be happening from doing that really made me question and go, okay, I don't get 2 shots at this thing called life. Do I want to maybe reevaluate what I'm putting in my body and kind of like you give myself the best chance for success here, at the end of the day?
Yeah, absolutely. Because, you do have to make that choice. So when, most people drive unleaded car, right?
Right.
So when you go to the gas station, are you going to put a diesel?
Right. No.
You're not, because it's going to break the car, right? So every day, humans, rather than putting super unleaded, they're putting diesel in their body, and they're breaking their body, and they're making that choice. And so I tell them, I'm not here to tell you what to do. I'm here to give you the information. What is the best way to achieve the optimal health? And here's the worst way. And then the life is a spectrum. And if you want to live in the middle of the road, I mean, that's your choice, right?
Right.
And so you may die early. You may, depending on your genetics also. But it's, I always say the genetics loads the gun and you pull the trigger. And so then you just have to make a decision.
And the genetic thing too, and I might kind of be rehashing something you just said, but on the genetic side, you always hear people say like, oh, well, heart attack runs in my family, or cancer runs in my family, or this or that runs in my family. And I think something important to point out, I've heard you say it before, but I've also heard it actually prior to meeting you on a few of the different documentaries that are really good at just educating people on these topics, is that the whole, family gene thing, it's really more of a function of, let's just say your great grandpa taught your granddad how to eat food in terms of the diet that they were on, those recipes and kind of those habits get passed down. You end up eating the same, stuff essentially. So if nothing changes in the process in terms of what you and the generations before you were consuming, it makes sense that you should expect to have the same problems. Hence, it runs in my family. Yeah. Versus,
So I say family genes is usually a family recipe. Yeah. Right? And then also the genes play less than 5%, role of 5%, less than 5% in the disease process. And there's something called epigenetics. Depending on your environment, the toxins that you get exposed to, the type of nutrients that you put in your body, that it can change the expression of your genes. Right. And so, especially that's the case with the people with the autoimmune disease. Their body is so inflamed, their body is attacking their own body. Right. And so, and it's the same process. The root cause of most of the chronic disease is an inflammation. And then depending on their genetic predisposition, they may develop rheumatoid arthritis. It may be the same cause, but then somebody else may have a lupus, and then their kidney fails and dies. Or somebody may develop Hashimoto's thyroiditis, and so they don't produce enough thyroxine from their thyroid. And some people may develop ulcerative colitis. And so it may express differently, but it's the same cause. Right. And so, but what all the study have shown is that depending on what you put in your body, you can even, especially for the cancer cells, you can quickly change what we call oncogenes. They're the genes that causes cancer. Right. You can shut them off, and then you can actually turn on the anti-cancer genes. So you have the ability to control. That's why I always tell people you have a full control of your destiny as far as the optimal health is concerned. And then health is a choice, and you're choosing to have diabetes, you're choosing to have cancer, and you're choosing to have a heart attack. So, and then, going back to your question, what happens with meat, the red meat and then the pork is considered.
Because you always hear red meat being like one of the worst things to eat. And from a meat consumption standpoint, it's like at the highest, like avoid that.
Yeah, avoid that because it's a class group 2A carcinogen. Okay. So it's just below, the processed meat is worse. And then after that is a group 2A, which is the red meat and pork, right? And then that means it will, if you eat enough, it will probably will cause cancer. Group 1 is it will cause cancer, and group 2A is probably will cause cancer. Like colon cancer is perfect example. The 80% of the colon cancer is induced by what you eat. Gotcha. Right? Wow. And it's number 3 most common cancer in the United States, and completely avoidable.
What's the number 1 most common? Do you know?
The number 1 is breast cancer for women, and then prostate cancer for men. Okay. And then prostate, colon. and especially, for guys, prostate cancer can be completely avoidable also. And if even you have prostate cancer, prostate cancer treatment does not extend your life. So they basically drill out your prostate, so you become incontinent, right? And then impotent, right? But then it doesn't extend your life. It doesn't fully cure you from the cancer unless you change your lifestyle. So if it's an early stage, the study have shown that conventional study versus the plant-based, everyone who's gone through the plant-based nutrition have been able to reverse the prostate cancer.
Wow.
If somebody with the advanced disease, right? So when they did the study, the one who changed their nutrition were able to live 19 additional years. That means that they had a recurrence of the prostate cancer versus 6 years of the people who went through the conventional treatment.
So if there's these kind of significant studies happening where there's these plant-based studies going on and people are literally reversing their cancer, why? And I think it's great for people to understand, why is this not being spread more in the sense of like, how come doctors by default aren't pushing this kind of, treatment by simply changing the food that you're putting into your body? Is it that they don't know and they don't understand like that happens? I mean, do they not get the training on it, or like how does that work?
Yeah, the sad thing is we were never taught this in medical school, right? Nutrition. We had less than an hour class of nutrition in medical school. Nothing in during the residency or fellowships.
That makes like absolutely no sense to me. Like that as a doctor, you're only getting like how long were you in school? Like how long was the whole process before you were officially, doing your own thing?
Yeah, so after 4 years of college, 4 years of medical school, 5 years of orthopedic surgery residency, and 1 year of spine surgery fellowship. But our curriculum is completely designed by the pharmaceutical companies.
And out of all that, though, 1 hour of nutrition.
1 hour. 14 years of training, I had 1 hour of nutrition.
Isn't that insane?
That to me, that blows my mind. Everything that you've learned, and then all of a sudden, here, we're just going to give you about 5 minutes of nutrition and use that.
Yeah.
Good luck.
14 years of education, and like that's like not even I wouldn't even call that a drop in the bucket. I mean, that's
at the same time, I probably had to memorize 500 different kinds of medications, right? And so it's very pharmaceutical driven. Pharmaceutical companies are multi-billion-dollar corporations, right? And they dump a lot of money into the medical schools and universities. They also fund tremendous amount of research.
A ton of marketing dollars spent as well. Yeah.
So doctors are they learn to how to manage the effect, not the cause. Right? You got to, so as you've seen it before, I show a slide where there's a faucet that's completely wide open. The sink is overflowing. And then there's a picture of doctors just mopping the floor, right? Yeah. Rather than actually shutting off the faucet, we're just constantly mopping the overflowing sink.
Oh, that's a great metaphor.
That's what the doctors do. We just basically clean up the mess, right? And that's a perfect example of treating the diabetes.
Right. It's the fixing versus the preventing.
Yeah, exactly. And not even really fixing the cause.
Oh, yeah.
It's just managing, putting a Band-Aid on it.
Right.
Right. And so that's why the meat, red meat is a group 2A, which means it will cause cancer if you eat enough. But what happens is with not just the red meat, all animal protein have carnitine in it, right? It also is high in choline. So when you actually eat the animal protein, once it goes into your gut, that gets into the whole topics of gut microbiome, which you could talk about for hours. But the gut bacteria actually converts them into what we call trimethylamine. And trimethylamine, once it's formed by the gut bacteria, and only people who actually have this type of gut bacteria are the meat eaters. So if you and I eat meat just once accidentally, nothing would happen. But when Derek eats the meat, then his gut bacteria is going to produce trimethylamine that goes into the liver. That becomes a trimethylamine oxide, and so it's shortly called TMAO, because that causes extreme amount of inflammation. That is a part of the cause of cardiovascular disease, and developing atherosclerosis, strokes, heart failures, right? And then not only that, the trimethylamine is a precursor for nitrosamine, which is a carcinogen, right? And then also if you cook the meat in high temperature, then one of the byproduct is a heterocyclic amine that's again carcinogen. And then the meat themselves also significantly elevate what they call IGF-1 or insulin-like growth factor 1, which once you're grown, you may need it when you're a baby because you need to grow. When you're an adult, you're done growing. Right? So if you're done growing, what is it going to grow? It's going to grow the cancer cells. So those are the factors that causes the cardiovascular disease, as well as the increasing the potency for developing cancer. But not only that, the meat themselves contains significant amount of saturated fat. Even chicken, most of the chickens are genetically modified, right? And so there's a modified.
Yeah, they go from being like in an egg to like 10 pounds in like a couple weeks. Like it's like
for a chicken to grow fully mature, it takes usually about 16 weeks.
Okay.
Right.
And a little exaggeration. Yeah. But still 16 weeks is
but now
it's pretty quick.
Yeah, but it's pretty quick. But then now they're genetically modified, so it only takes them 6 weeks. And most of the chicken naturally are fairly lean, but then they're genetically modified so that their breast is so big because everyone loves, chicken breast, right? And then they can't even stand up. And so they're sitting on the ground most of the time, developing ulcer, like decubitus ulcer.
Right.
So they have to be fed with the antibiotics. But another reason to feed the antibiotics to the, farmed animals is so that they'll grow much faster. That is partly the reason for antibiotic-resistant bacteria that we're, fighting at the hospitals all the time.
Because we're actually consuming these animals that already have the antibiotics injected into them. And so then we're then consuming those antibiotics when we actually eat those animals.
Absolutely.
Right.
And then on top of that, then they inject a bunch of hormones, right? So that they'll grow much faster. And then also because they know the industries know that the fat tastes better, so they're genetically modified so that their breast muscle is not only big, but they also have significant amount of fat. Wow. So chicken, on average, Americans consume about 98 pounds of chicken per year.
Wow.
Right? And that is considered one of the number one reason why there's so much obesity. Wow. People are consuming so much chicken. During the Super Bowl alone last year, Americans consumed 1.35 billion chicken wings.
Just during Super Bowl.
Just during the Super Bowl day.
1.35 billion. Wow.
How
many of those wings did you contribute to that number, Derek, on Super Bowl?
Quite a few.
Yeah.
Well, I'm kind of curious, Derek, I know you've been listening to a lot of this. Do you know any athletes in terms of like other guys you play ball with, maybe with or against, that are plant-based or vegan athletes are kind of going towards that trend? Have you seen any of that?
One of the guys that's on the team actually now, I can't think of his first name right now. This goes back to like us saying the whole doc thing. Coonrod was his name, and
he plays for the Giants.
Yeah, he's one of our guys. He's at Big League camp right now. I don't know. Again, I don't know much. There's so many new faces that I couldn't tell you.
What position does he play?
He's definitely a pitcher.
Okay.
But he, at least I think he is 100%. But he's, he is vegan. And hearing everything that you just literally were saying, it just makes you, for those that are listening, I'm sure they're going to think the same way that I did. It just questions a lot of, is this something that I want to continue to do and only be hurting myself?
Yeah.
The saying is, this is my temple, or this is my car.
Yeah.
You want to fuel the system. You want to feed it the right fuel. So you definitely got like me, wondering about all that stuff. And I'm not hesitant to even try or do any of that stuff because I've done it before. And I've seen the benefits, and I've seen, how it makes me feel. I have nothing against it, and never have, never will, because that's just who I am.
When you experienced it, was there anything that you weren't a fan of, or that you kind of struggled with that month that
just constantly being hungry? That's the only thing that I would say is I noticed that you're filled more when you're eating, the meat and such. Whereas, and this is me, I mean, it could be different, maybe it's just, I'm not getting big enough portion sizes. I know one thing that I've learned about my eating in general is, before, when I got a plate, I filled the freaking plate. Whereas now it's not supposed to be that. The plate is just something to put it on.
Right.
You're not supposed to have the portions that are covering, it's not to see if we can cover this.
Crazy.
Yeah, it's supposed to be small. And that's one thing that I learned from a couple of the Japanese guys on my team was watching them, and something that stands out with the chopsticks, for instance. That gets you to eat smaller amounts of food. If you actually look and watch when you're eating this food with the chopsticks, you can't take down as much. If you give me a fork or a spoon, I'm shoveling that down. That's one thing that stands out. Like your portion size of eating itself is smaller when you're with chopsticks. And again, like I said, your plate is not supposed to be covered. You're supposed to have like a smaller amount of everything.
Yeah. But I think the hunger factor, which can be easily be modified because it's the calorie density, right? Obviously, meat is much more dense as far as the calorie is concerned. But there are type of food that you can also eat, like sweet potatoes or potatoes, within the plant-based, and the beans and whole grains. That's gonna fill you up. And that's why like the 1/3 of or I think it's now up to about 1/2 of the Tennessee Titan guys, led by Derek Morgan, they're all plant-based.
Oh, I had no idea.
Right. And so
I didn't know that either.
DeAndre Jordan, who was with the Mavs for a little bit, now he's out in New York. He's fully vegan. I actually think he might be an investor or have a piece in Beyond Meat as well. The company.
So what they found is more and more professional athletes are switching because they know that they can perform better and they're recovering faster. So in the spring, there's going to be a movie out that's by, it's called Game Changer. It's about professional athletes and Olympians that are plant-based and why they're going plant-based. And in fact, there was actually a funny portion. They got the college athletes and then they did a small experiment, 3 guys. The first day, they gave them some sort of a meat dish, right? And then they worked with the urologist. So they had a little caliper, the like measuring device, and they put it on their penis. And then they saw.
This is your favorite topic.
Yeah,
Derek.
it's your favorite topic, Derek. And then overnight,
not penises.
Yeah, they measured the number of the erections they had, and then also the girth of the erection.
Yeah.
Right. And then.
So wait, hold on. So you're telling me if I go vegan, I'm gonna have bigger boners?
I'm not finished with the story.
Welcome to the club, Derek.
And then the
sign me up, please.
Yeah. A week later, and then they gave him a whole plant-based dish. And then they did the same experiment, right? They wore the device and then they measured the amount of the boner they had and then the size. And it was significantly larger and longer, right?
So are you telling me if I go vegan, it's basically like getting a penis enlargement? Is what you're telling me right now.
Yeah, absolutely, right?
I guarantee all the guys that are listening now, we are switching to vegan
Well,
right now.
So it's funny, like, and it's a little off topic, but it kind of relates a little bit. So I was at the dentist recently having some work done, and I'd known a little bit about this, but it kind of goes back to what you were saying about the bacteria in your gut biome. And then also, if your gut biome is extremely important, but then also like the bacteria inside your mouth is extremely important as well. That can dictate, you having bad breath down to a lot more serious things like heart disease that are directly connected to the health of your mouth. Yeah. And so the dentist that I was at, her name's Justina Alaska. She's awesome. She's out of Fort Worth. And she was just sharing some of this. And one of those things was erectile dysfunction is directly associated with the oral health. Yeah. There we go. We got a Bruce appearance.
They're out.
Welcome, Bruce. But then also she has cardiologists on a regular basis that will not even operate on their patient until they go and see her to be cleaned out and examined by her to try to figure out the problem going on inside the mouth as well. And it's interesting to see how those things can correlate, with, you wouldn't think they're connected and they really are.
It's all about circulation. So if you have erectile dysfunction, that's the first sign that you have a heart disease. Because it's all about the flow, right? If the blood is not able to flow to your penis, you're not going to get the erection.
So what's weird is like, I feel like they don't usually talk about that because they usually just isolate it as a problem, like it's its own thing, and take this erectile. You see like the medications they advertise for like the erectile. So is it pretty common though? Like once a guy goes in for like an erectile dysfunction situation, telling his doctor, do they just usually prescribe the ED medication or do they prescribe that and then go, hey, you really need to go see a cardiologist because more than likely this is what you're going to end up.
I think if they're
dealing
progressive, they would recommend they go see the cardiologist, but most of them are just going to prescribe the Viagra or Cialis, right?
Right.
But if you don't have the good blood flow to begin with, and then what you need is a nitric oxide, the Viagra only works for 50% of the population.
Okay.
And so the way it works is it's an enzyme that prevents the nitric oxide from degrading. And so if you don't have it to begin with, then there's nothing to prevent it.
Nitric oxide, is that in your blood?
Yeah, it's just in your blood.
Okay.
And so naturally, the nitric oxide is produced within your artery, and it's a inner lining called endothelium, and that's the nitric oxide has the ability to dilate your blood vessels, and then also make your mitochondria increase in numbers, biogenesis, and make it more functional. And then it help you even further produce the nitric oxide. There's a whole list of the benefits of the nitric oxide. Without nitric oxide, you can't deliver oxygen. So without it, you're going to die, right?
And does your body produce that all of your life, or?
Great question. So, but when you're 20, in your 20s, you are able to produce pretty much 100%. By the time you're 40, there's enough damage to your blood vessel. You only produce about 50%. And by the time you're 60, then you lose about 85% of your ability to produce the nitric oxide. That's why the oral health is very important, because your body lost the ability to produce nitric oxide, but there is other way you can supplement it. And then that is through the nutrition. But so the nutrition wise is the dark green leafy vegetables like, arugula, spinach, kale, and those type of food. When you eat it and when you chew it, it mixes in with your mouth bacteria that converts the nitrate into nitrite. And then your stomach has to be acidic enough to convert the nitrite into nitric oxide. So that's why if there's a strong correlation with antiseptic mouthwash with heart disease, because not only it kills the bad bacteria, but it also kills the good bacteria that you want on your tongue. And without it, you can't produce the nitric oxide. Chances are that you're going to develop heart disease.
Wow.
Right? And so then also the strong correlation with people use proton pump inhibitors such as Prilosec, Nexium, or antacids, Pepcid, Zantac. They have a strong correlation with the heart disease as well. Because if your stomach is not acidic enough, then you can't convert the nitrite into nitric oxide. So you can't produce the nitric oxide you need in order to vasodilate, maintain your blood pressure. And so the ones who use antiseptic mouthwash or people who use Prilosec in long run will develop hypertension and develop heart disease.
So you've done something to help, with the nitric oxide problem, right? Mm-hmm. In the sense that it's a problem in the sense that your body naturally is going to start producing less. Mm-hmm. So you got to counter that, and that's through nutrition. But then also, I'm actually wearing right now this NeoGen t-shirt, which Dr. Juan dropped off, which I got to say is a nice t-shirt.
Yeah. Thank you.
I'm gonna have to ask you where you got this from, because we might need to switch over our t-shirts for Derek over here. I sent him a secret Handshake podcast shirt, and he claims that it gave him a rash. I did not experience this. I think that
there was something. I'm telling you, it's the only two shirts I've worn two shirts, and that was it.
Yeah,
both of those, that and the hoodie.
I didn't experience that at all. But anyways, really appreciate the shirt, Derek. I got a shirt he brought a shirt for you as well, and then he also brought these products, and I'm gonna ship yours out on Monday. But you developed these with a team, right?
Yeah. So I developed it with the regenerative medicine specialist, because nitric oxide, not only it's great for your heart, also great for your brain health, but also it's critical for stem cell. Without nitric oxide, you can't actually activate the stem cells.
So that's like an integral part of the stem cell therapy itself.
Yeah. So I think we're the only clinic that really focuses on nitric oxide, because a lot of people are not aware of the importance of nitric oxide. So we try to find the product. We initially did not intend to produce the product ourselves. And what I was initially prescribing to the patient is the same thing I do for patients who's trying to reverse the heart disease, having them eat dark green leafy vegetables 6 times a day, right? For breakfast, snack, lunch, snack, dinner, and
dark
snack.
green leafy vegetables. Yeah. That's 6 times a day is a lot. That can probably be difficult for some people to do that and accommodate that kind of schedule, right?
And so if you had a heart attack, massive heart attack, and you're trying to save your life, they may be motivated.
Right.
For most people, eating dark green leafy vegetables in that degree 6 times a day is pretty challenging. Although I try to do my best, my goal is to consume about a pound of dark green leafy vegetables in a day.
Are you pretty good at doing that?
Yeah, I do that through not only through the salad but also smoothies. Whole pound.
Wow.
Yeah, that's always my goal. Sometimes I just get so full that I just can't consume that much. Right. But at least you got to have a goal.
It's like right? It's kind of the visual the visual I get is Popeye the Sailor Man, just throwing those spinach cans back and
the cans, squeeze them out.
Yeah. And it makes sense because that cartoon makes total sense, because with the dark green leafy vegetables, you're going to increase the nitric oxide. That's going to increase the blood flow to your muscle, right?
Right.
And then, some of the bodybuilders, and they discovered it, after the 3 scientists won the Nobel Prize for discovering it. And then, but they have so much, those products have so much stimulants and caffeine,
right,
which is counterproductive because they're vasoconstrictors.
Yeah, like I used to take one that was called, like when I was in high school, called Inno Explode. It was real popular at the time, and that's what it would do. Like, Derek, I don't know if you've ever taken like one of those pre-workout kind of, you would take it with like your whey protein, kind of get you like amped up, and like a lot of times they have like caffeine in them.
It has caffeine and other stimulants.
Yeah, that's what I take now.
Yeah. And like you can feel it, like my ears would start to tingle sometimes, and like different, stuff like that, and you could kind of almost feel like a warmth in your like muscles a little bit. But yeah, obviously that other stuff in there is not really what you want to be putting in.
And that's not what we wanted our patients to utilize. And so then therefore, and that's why we developed the nitric oxide supplement, which is made with just the pure natural ingredients. And so it would increase the blood flow. But nitric oxide is so critical because most people could not eat the dark green leafy vegetables. That's why we developed the supplements.
Right.
But what we found was also, it naturally made sense, not only it stimulates their and activate their stem cells, but it improves the cardiovascular system, lowers their blood pressure. It increases the blood flow to their brain, so then their cognitive function is significantly improved. Also, without nitric oxide, people develop insulin resistance. So not only the fat inside your cell that causes the insulin resistance, without the nitric oxide, you can't also activate the glucose transporter. So that's part of the reason why you develop the insulin resistance. So if you get depleted,
is that what then takes you to being a diabetic or
type 2
evolves?
diabetic?
Okay, gotcha.
Yeah. So if you don't have enough nitric oxide, your diabetes gets worse, which produces less nitric oxide that increases the likelihood of further damaging your body, so that you develop the type 2 diabetes. And so it becomes a perpetual cycle.
Okay.
Right? And then of course, all the guys were coming into the clinic and said, hey, not only my knee feels better, I feel like a teenager again. Right. And so
is NeoNox is the regenerative nitric oxide activator. That's the nitric oxide element, right? So where can people get this? This is what it looks like. Just for everyone at home, check it out on YouTube.
So you can go to NeoGenNutrition.com, NeoGen nutrition.com, and you can purchase it online.
And we'll throw that in the description, and then we'll do an Instagram post pointing to that. But then, what is the Neo Antiox? So this is the other product that Dr. Juan brought for us. I mean, Doug.
Or Doc. Or Doc.
No, you can only say Doug. I have to say Doc. Get it right, Marty.
Yeah, my bad.
One of the most important things is, I think I mentioned before, the root cause of the majority of the chronic disease is inflammation.
Right.
And so we need to find every way possible to decrease inflammation. So not only eliminating the food, in my mind, most of the animal product that causes inflammation, but you also have to consume things that are anti-inflammatory. And most of the plant-based food are anti-inflammatory, but such as there's certain things like the spices, such as turmeric, and then within turmeric, very active component, the curcumin.
Yeah, I actually take those capsules every day.
Yeah, and those are very anti-inflammatory, but also antioxidant. And then also ginger extracts, which are again very anti-inflammatory, antioxidant. And then we have something, I don't think, we have not been able to find the product that contains all turmeric, ginger, and amla. Amla is an Indian gooseberry powder. It is one of the most powerful antioxidants that's out in the market. And it's about 100 times more antioxidant than blueberry skin.
Right.
And
which most people, I mean, they know blueberries to be like a superfood.
Which is a superfood,
But this is 100 times more of a superfood than the blueberry.
Than blueberry skin.
Right.
And the study have shown that most people in America, I believe about 50 to 70 million Americans are on statin drugs to lower the cholesterol, which also comes with significant amount of complications, right? And the natural product amla, Indian gooseberry powder, has its ability to lower the cholesterol just as well as statin drugs, and that's been studied multiple times.
Wow.
So So those are the to fight the inflammation. We recommend taking some form of natural anti-inflammatories.
Right.
And if you can, you can go to the grocery store and find the turmeric powders and ginger powders. It's not as potent, but you can use it whether in your smoothies or cook with it to enhance the anti-inflammatory effect. For turmeric, you definitely need to use add the black pepper or black pepper extracts to increase the bioavailability by 2,000%.
That helps it like get into your bloodstream better. Is that okay?
It prevents the degradation of the turmeric inside your body. Your
pepper.
liver chews it up. Yeah.
Okay.
And so without it, it may add spice to your food, but it's really not doing it.
So these capsules already have that black pepper inside.
Yeah,
okay.
has the black pepper extracts inside.
I'm really excited. I mean, I'm excited about both of these, but I'm really excited about the Neo Antiox just because I already take the and I never know how to pronounce it. I always say curcumin, but it's curcumin. It's
curcumin.
I take the curcumin capsules every day. I take a probiotic.
Yeah.
But this right here just really simplifies the whole process because you got it all wrapped up.
Yeah.
In my smoothies, I've got the amla and I've got the ginger and all that kind of stuff that I'll throw in there. But this is, really a whole lot more convenient.
Yeah, because you have to take it throughout the day. So I have it in my smoothie. So if I'm drinking the smoothie, I have turmeric and ginger powder and amla, which is great. But then when I'm running around the hospital, because the turmeric gets washed out of your system so fast, you want to have it all throughout the day.
Yeah.
And so then during the day, then I might pop in a few capsules. When I'm at the hospital,
right?
When I can't drink my smoothie,
right?
And so just to make sure that I have enough turmeric, which is it's a very strong anti-cancer spice, right? And then in my system all the time.
That's awesome. I think that's great. So one last thing, and we're gonna be wrapping up here because it's another. It's actually going to be the longest episode that we've had so far, which is awesome. You just set the record. So let's see if you can beat Rami's record with the minutes viewed in the first 4 days. I'm going to need you to work on that one right when we launch this. But your anti-cancer smoothie, just kind of if you could break down real quick, just rifle off all the ingredients that you put in this every day. You have this every day, but I'd like to just, if we can, obviously it's going to be here on the podcast, but we'll make a post on Instagram just kind of breaking down the ingredients for it. So if anybody out there wants to like start incorporating this into their diet, I mean, it's not magical. It's just food that you're blending up, and that's the secret here. But what are those ingredients that you're?
So the first thing is within the smoothie, the most important thing is the dark green leafy vegetables, right? And then adding variety of dark green leafy vegetables. So one of the most important one is the broccoli sprouts. Because it has a tremendous amount of sulforaphane, 50 times more than the broccoli itself.
Right.
So the broccoli sprouts is very important.
And sulforaphane is like an anti-cancer.
It's a very anti-cancer
very potent,
substance,
right?
Very potent. And then also it really enhances your cognitive function. Some of the study have shown that kids, autistic kids, they have improved their brain function by 50% after being on the broccoli sprouts for 90 days. So, which is that's pretty amazing, right? And then some of the patients who had the elderly patients with dementia, they also shown significant improvement with their cognitive function. And so not only for anti-cancer purpose, but also for cognitive function, I strongly recommend broccoli sprouts. And then I get spinach, kale, arugula. Arugula pound per pound has the most amount of nitrates. So it produces the most amount of nitric oxide. Okay. A lot of people think it's a beet and then they drink beet juice, which is great. And the study have shown that it can enhance their athletic performance by 16%. But actually, arugula has a significantly more nitrate. And then also you need a healthy fatty acids. So I put in half a cup of flax seeds and then also add hemp seeds. It's a good source of protein. And then also chia seeds as well. And then the other ingredients are the pumpkin seeds and walnuts to enhance and to further enhance the omega-3 fatty acids. And then definitely add the berries. And we recommend eating some form of berry. It's at least a serving a day, right? And so I add blackberries, blueberries, and the raspberries and strawberries. And strawberries also has shown to be anti-cancer. So I add those. And then I add the spices. I add the turmeric, I add the ginger, and then I add the amla, Indian gooseberry powder. And then for taste, and I also add the bananas, And then I may also add celery, parsley, and then you can just, I think I have about 18 or 19 different ingredients on the,
that's a smoothie. You're not getting that at Smoothie King. That's for sure.
Yeah.
Without a doubt, you don't.
Just a little bit different than what you get at the Smoothie Kings, right? And the friend of mine just became a CFO at the Smoothie King, but I, I'm gonna let him know. Let's kick it up a notch.
Yeah, I'd say so.
Yeah.
Okay, so this has been an awesome experience having you on the show, man. It's Derek. I think you could probably say. You learned, I learned a ton. I knew just on like the plant-based stuff, I knew a good amount, but everything that we talked about is, it's incredibly interesting information. I mean, I think it's great to get the insight from someone like you who deals with literally operating on people's backs every day. And, you're just so diverse from the spine surgeries to the stem cell therapy, but then the plant-based nutrition element, you've really kind of got a fully rounded out perspective when it comes to just improving the lives of your patients, which is pretty cool.
I mean, just in general, T said a lot of exactly how I feel. I mean, you've changed a perspective for me it's a game changer without a doubt. And I think people that are even listening are going to view it the same way. They're going to realize how important this stuff really is. Because at the end of the day, Taylor, now I'm using your first name, literally said it like you only have one of these. You have one life, one body. You have to do whatever you can to make it right. And hearing the things that you're saying, it's going to make more people question, am I doing it right? Am I doing the right thing? And then hearing about your thoughts on the stem cell. That's another thing with people that have injuries, that have gone through injuries, or, they're thinking about what can they do to better themselves in that aspect, such as like for myself, my knees. Like I would love to do something that's going to help out with my left knee that I've already had surgery on, that's going to benefit me. So I think all this stuff that we've got to hear from you today is like, to me, you're one of my favorite guests just because of the things that I've got to learn that's going to change my life. Not just something that I'm going to hang up here and we're not going to talk and walk away going, well, I could have done it. I'm actually going to be sitting here thinking hard to myself of what I've learned. I need to stop doing this. I need to stop doing that. I need to pick this. I need to put this in. I need to put this out. Those different things. I mean, you've explained so much to myself that doesn't know enough about it. I've heard stuff from T and also my buddy Cook with, the veganism and vegans and all that stuff. And it's a different perspective. It lets you see things that you definitely didn't see before. And I know the viewers, they listen to our show and they're fans, they're going to see the same thing too. And for me, and I know he's going to say the same thing too, seriously, thank you for everything that you just came on here and helped us with by knowing with the knowledge bombs that you had.
Knowledge bombs.
It's true though, is it not?
Well, he did. He dropped them. He dropped them on us.
You dropped everything on us, and it's like, we'd let you run the show because you had the truth. Like you are the truth when it comes to all this stuff. And from me and the fans, like, thank you, seriously.
That's his
you taught us a lot.
Superstar slogan, the doc, I am the truth.
That's your finishing move.
Yeah,
the knowledge bomb.
Finishing move is the knowledge bomb.
Yeah.
Off the top ropes, here comes the knowledge bomb. Boom.
Yeah, exactly.
Well, it's truly been an honor, and I'm thank you for giving me the opportunity, and I think hopefully your listeners would get something out of it. And then, especially also for you, as I mentioned, more and more professional athletes are becoming plant-based because they not only recover so much faster from their injuries, because you're injuring your body every single day when you're out in the field, right? But also you're performing better because it's you're getting the right nutrients. You're fueling. Because I see food as a fuel. And I love the taste of food, but I also first see it as a fuel. And that's what you need, especially at the professional level, right? Right kind of nutrients, right kind of fuel. And that's going to allow you to perform better. And then once they kind of move away from the traditional idea of, I got to eat just shitload of protein in order to perform better, open and be open to the truth, then you are going to perform significantly better at a whole another level.
Yeah, no, that was awesome. And expectation wise, you killed it. So you don't have to worry about that. You set the bar for the time, and the whole episode was entertaining. We got to learn so much. So again, thank you.
I think this is where you hit us with the sign off, Derek.
Well, I mean, again, from both of us, the Secret Handshake podcast, we thank you for coming on the show. But until next time.
Thanks for listening, the listeners. I mean,
the listeners as well. Sorry, I did not mention them.
And then until next time, what?
Until next time, we will have a different guest. It's a surprise. But we thank you all for listening, sharing your knowledge bombs. But I'm out. Okay, bye.
Bye. Bye.
That was good. I like how you did that.